speaking online.
The audio sounds great.
Well, that's a high bar. Like, we will never achieve that again.
We're working out the kinks. I feel like we've hopefully got this down.
No, yeah, seems good. Well, then I was gonna suggest we get started. Unless Chicky, is there any business in the room we need to hit first?
I think we are coffeeed up and refreshment up, whatever verb that is. I think we are ready.
Excellent. Well, thanks everyone for joining. Really sorry to miss you in person. Past status being what it is, all of the snow is apparently coming in 2 days. So that's what we're getting. So I wish I could have been there, but thanks for being here and appreciate everyone taking the time. I think probably next up is roll call. Chicky, are you able to call the roll?
I would be happy to. So good morning, everybody. My name is Chicky Flowers. My pronouns are she, her, hers, and Shakanya, and I am the director of the Oregon Health Insurance Marketplace. I'm currently in the room waving my hand. If you can see me somehow, some way, wearing a white shirt today. About to start the roll call. If you are in the meeting, if you can please let us know. HIMAC committee members, if you are in the room or joining us in person, virtually through phone or in video. Okay, so starting with Marin Ariola, Stacy Carmichael.
Hello, I'm here and in the room.
Charles Fisher, Ron Gallinat. I do know Ron, I think, was in the Teams, so he might be in transition to Zoom. Paul Harmon.
Here in the room today.
Cheryl Lindsay Hopper.
Joining by video here.
Thank you. TK Keene.
Joining by video today, thanks.
Kathleen Orick.
She said she was running a little late to come in.
Okay, sounds great, thank you. Claire Pierce-Roble.
Here in the room.
Om Zucchini.
Here.
Dr. Catherine Souza. Nishoba Temperley.
I'm here, present in the room.
Matthew Woodbridge.
Here in the room.
And Elena Zbiri. Yeah, here. Thank you. So Lindsay, we do have quorum.
Great. Thanks, everyone. And just a note that I can definitely see there are people in the room, but those of us online can't see. We'll probably not be able to see raised hands in the room. So if someone in the room could just help me out with that going forward, that'd be great. Certainly don't want to miss someone trying to contribute to the conversation just because I can't see that. Next slide, please. Okay, we're going to cover our meeting guidelines. Next slide, please. So we are committed to a safe and inclusive meeting for everyone in attendance. Our composition of the group is really brought together to have differences in opinion and different experiences. We welcome all questions and all ideas. We invite all members of the group to speak, and certainly the public through public comment. So if you're online, if you can, use your virtual hand. And when you come off of mute, please remember to do your best. I also struggle with this, to say who's speaking. Or you can put a question in the chat, and then in the room, if someone could help us out, that'd be great. I believe we do have real-time interpretation today, so moderate pacing helps. And then for those of us online, if you're able to be on camera, please do so, and mute when you're not speaking. Next slide, please. I should have said, Chicky, thank you for calling the roll, and we'll call votes that way. I mentioned this, but public comment, there's a few sessions. And then, of course, if you experience anything unacceptable or have witnessed anything, please reach out to Chicky, again, committed to a safe and inclusive space. With that, we are headed to meeting minutes. Those are in the packet from February. That time went quickly. Is anyone in a position to make a motion on the minutes?
Yeah, this is Neshoba. I move to mention to pass.
Thanks, Neshoba. Is there a second?
Sakina, I second it.
Thank you. Okay, any discussion on the minutes? Any questions? Okay, Vicki, would you please call the vote count for the minutes?
Happy to. So again, HIMAC committee members, once I call your name, please let us know how you vote, if you vote to approve or not approve the minutes. Maureen, have you been able to join, and how do you vote for the minutes? Stacy, how do you vote?
Approve.
Thank you. Charlie Fisher? Ron Gallinat? Paul Harmon, how do you vote?
Approve.
Lindsay, how do you vote?
Approve.
TK, how do you approve? How do you vote for the minutes?
I'll approve.
Thank you. I'm manifesting your approval. Thanks very much. Kathleen Orick is not here yet. Claire, how do you vote?
Approve.
Thank you. You were the second motion. Dr. Catherine Souza, how do you vote? Neshoba was first motion. Matthew, how do you vote?
Approve.
Thank you. And Elena, how do you vote? Fantastic. Thank you. With quorum and with a majority/unanimous vote for those that are in the meeting today, the minutes for February 16th meeting are approved.
Okay, I think we're moving on to state-based marketplace. Could the team please take it away?
Yes, again, good morning, everybody. Chicky Flowers. Pronouns are she, her, hers, and I'm the director of the Oregon Health Insurance Marketplace. I am joining the team today, helping provide some high-level project updates for our state-based marketplace. Next slide, please. So we have a few items to cover today, outlined in this slide for you: implementation timeline, key project accomplishments, a high-level overview of our engagement with the Centers for Medicare and Medicaid Services, or CMS. We would also love to introduce you to our Oregon SBM technical team from the Office of Information Services. And then we are also going to give you a high-level overview of our marketplace training plan. Yes, it is that time of the year and time of the transition that we are finally able to get to training, and we are very, very excited about that. And then also we are joined by our teammates from Get Insured. They are in person in Salem with us this week, and then they have graciously accepted your invite to come and pretty much just hang out with us and then maybe share their feedback on how the transition is going. They have years and years and years of experience with transitions from different states. So just giving us a little bit of gossip and tea and information on how things are going. So next slide, please. So this is our state-based marketplace project timeline. We are officially, and we have been officially, in phase 2 of implementation. It is pretty small, and hopefully if you get a chance to enlarge those slides. I am having a hard time enlarging my slides and also my paperwork, but we are definitely, it's looking well and good. We are, I believe as of this week, we have officially completed configurations of the first round, or the baseline configurations for the SBM platform and our consumer assistance center system. So CAC on the 9 blue stands for Consumer Assistance Center. And then we are really ramping and chomping at the bit to conduct system testing and UAT, or user acceptance testing. So that's the next couple of months through August. And then in May onwards, we're still in implementation mode. And really all of these kind of different levels of implementation are outlined in this slide for you. Want us to cover in future meetings, and or if you have any specific information you would like, we would also be happy to connect with you offline after this meeting. And then next slide, please. Since we last met in February, some of our key project accomplishments are, so in March, we approved the training plan for the system. We also completed the One System, or Oregon Eligibility System, SBM design documentation, review and approval back in early March. And then in late March, we approved the IQMS monthly status report. This month in April, it's only April 16th, but again, we have been kicking out deliverables left and right. We were able to finalize English and Spanish user interface content in early April. And a couple of days ago, we also completed, I believe, initial reviews and configurations for the one SBM infrastructure. All right, next slide, please. And I am so sorry. Those two slides were supposed to be Victor's, and I just told him about that. And I totally just took over everything. So I am so sorry. Victor is here to present. But again, how about Victor, you take my slides since I took your slides.
I was going to say, oh no, but you did just great. Hi again, everyone. Victor Garcia, Operations Advisor and Program Liaison for the Marketplace. Pronouns are he, him. And so this is just our chart for our engagement with Centers for Medicare and Medicaid Services. That's CMS. They're under Health and Human Services, HHS, at the federal level. For those of you a little less familiar and kind of newer to joining us. And they're really the oversight entity that is approving our move from a state-based marketplace using the federal platform to just a fully state-based marketplace. That involves a lot of steps, a lot of approvals, a lot of documentation. So this is just outlining some of the specific bodies of work that are contained within that. So I'm not going to go into detail on these, but starting at the top, safeguard, security report, you'll see a lot of abbreviations, so SSR. That along with some of the other ones like the privacy impact assessment, system security and privacy plan, those are all part of a suite of documentation and attestations and conversations that kind of supplement those regarding our preparedness for IT security. So just making sure the information that we have for all of our enrollees is safe, secure, and being done according to industry standards. There's something that is a little newer this year. So they're changing the security standard from what was called MARS-E, I forget what that stands for, but it was a compliance standard based on a number of universally sort of accepted NIST standards, and they're changing to what's called ARC-AMP, ARC-. Again, what that actually stands for is escaping me at the moment, but it's long, and just suffice it to say that's the security standard by which we have to implement all of the marketplace safeguards, and so CMS is in charge of making sure that we have done that properly in order to allow us to go live on November 1st. So we're submitting all the documentation that's required for that. So that includes our point of contact list, that privacy plan, the privacy impact assessment, intergovernmental cooperation agreement, and the interconnection security agreement. They're all part of that suite. And then that last one is a little bit newer also, and that's there are some services that previously the federal government did not charge for when we used the federal hub to get information about enrollees to make sure that they qualify for things like premium tax credits. So now they have begun charging for that, I think starting a year or two ago. And so we just had to submit information about how we were going to take care of that when that time comes. So far, if I haven't made it clear in previous meetings, the people that we engage with from CMS have been exceptionally engaged. They've started this early. They're numerous. We have lots of points of contact for each of the different subject areas, and they've been accommodating and helpful and really flexible in terms of getting these things submitted and explaining to us really what the requirements entail if we're not absolutely certain ourselves. So again, working with them has been fantastic, and don't see any reason that will change. So this is all leading up to the summer when we'll be doing our assessment for operational readiness, and they'll be assessing us to make sure that we are ready to go live. So that's all to say. This is all going well. You can see there's a lot of little items, but again, we've got it all kind of worked into the plan, and this is all proceeding according to the schedule.
All right, so thank you, Victor, for taking my slide and doing a much better job than I would have. And so next slide, please. So not surprisingly, the state-based marketplace team, the Oregon Health Insurance Marketplace team, our project team, we are growing in leaps and bounds as we should be, because there's a lot of work, and we have been partnering with Office of Information Services. I believe I got that acronym correctly. They are our shared services with team with ODHS. We now have our own SBM technical team, and we are super excited that they have joined us today. So I would love to introduce Albert and Rich, and they will introduce our SBM technical team.
Yeah, so, excuse me, my name is Albert Salinas. I'm one of the system managers for Same-Based Marketplace. We're operating in 2-in-a-box, and my counterpart is Rich. He is here with me today. We've also hired a solutions architect and an interface senior systems analyst as well to assist with the project. I'd like to believe that we brought on some excellent staff to assist in this process. Rich has a lot of experience around these sorts of projects and is also currently managing MMIS. So a lot of experience and knowledge bringing to the team today. Next slide, please. So we are currently focused on making sure that we're understanding the systems, getting to know individuals, and preparing for user acceptance testing. We're also looking to the future as we transition to maintenance and operations to support the system testing and enhancements and ensuring that as we move forward that change requests are reliable, high quality, ensuring that we have a great experience in the marketplace. Anything else you'd like to add, Rich?
Yeah, I think that's great. Essentially, our job is to integrate the solution within our own ecosystem and ensure that there's consistency in processes and whatnot. So I think both happy to be here to support this effort.
Absolutely. Next slide. Thank you.
Okay, thank you very much. So we officially have 4 new team members from the SBM technical team on the OAS side of the house. And we also are joined by our one of our newest members on the marketplace team, the program team. I'd love to introduce Jeff Wilcox. Wilcox, he is officially the marketplace training coordinator. Take it away.
Good morning to you all. We'll start off with our marketplace training. Who will we train? We'll be training two different courses for agents and assisters. About 90% of the training is the same, but it's different enough to justify 2 different trainings. Next slide, please. All right, we're going to start off our training year in May with our Train the Trainer workshop. And that is focused on trainer skills, not necessarily marketplace information, but we think it is going to enhance our delivery substantially. We're going to do a pilot in-person and webinar training for marketplace guarantees in July. And that's where we're going to have a select group of our agents and other community partners come in and really give us a good look at our training and see if there's any revisions we can make. We're going to launch in-person and virtual training to all assisters and insurance agent mid-July. And then on August 1st, we're going to launch our in-demand to all assisters and insurance agent. And we'll conclude our training at the end of the season in July. Next slide, please. Next slide, please.
Is there any chance we could maybe mute the room? It's just there's a lot of background noise that the mic is picking up. Thanks.
All right. Our program is going to be, our slides are going to be designed to align with both federal and state requirements. Our training covers key areas, including eligibility, application, enrollment, plan comparison, cultural humility, privacy and security standard, and assister roles. Our training is designed to ensure accurate, compliant, high quality consumer support. And we have a placeholder slide in our HR1 section right now in our training, but that'll be filled in as we solidify what we need to be on it moving forward. All right, we're going to go back one, please. All right. No, one before that. There we go. Okay, our training will be available in virtual, in person, and on demand. All in-person and virtual trainings will have an on-demand component to it. Our privacy and security and cultural humility, along with the examiner, will be on the on-demand portion. All formats will be available in both English and Spanish. Next slide, please. All right, the effectiveness of our training program is going to be measured through training completion and surveys. Our goal is for at least 80% of the agents and assisters to complete training and to get a minimum of 4 to 5 stars on our survey. Next slide, please. How can we strengthen our training plan? We have a few questions we'd love to ask the board. Are there themes or issues other than HR1 that HIMAC wants us to emphasize to better support our agent and assister network? Our second question would be, does the HIMAC have any concerns with key milestones in our timeline? What channels do you think would work best for communicating training information to our attended audiences? And what would help organizations feel more confident going into training this transition year? And what barriers would should we consider that make training difficult to access, complete, or use effectively? All right, that's all for me. I thank you for your time.
I'm thinking maybe the room could come off mute.
Thank you, Lindsay. This is where I'm like, okay, press my unmute button, but then recognizing we're in.
You're doing great. Yep.
Okay, so thank you, Jeff, for providing the high-level overview of the training plan for this coming next couple of months. So what you have in front of you, sorry, again, this is Chicky Flowers. I'm in the room in Salem. You have a couple of prompting questions for you all, and we would, of course, love to hear your feedback. So we will go through kind of question one by one, and then please feel free to jump in. Raise your physical hand, since we in the room will do our best to catch you. And then if you are in the virtual room, please raise your virtual hand so that we can also capture your feedback. So for the first question, are there themes or issues other than HR1 that you all want us to emphasize to better support the agent and assister network? Stacy.
So Stacy Carmichael, I'm in the room. I was hoping that we could have some sort of emphasis on any type of data transition or migration. That is something that we're getting a lot of questions out in the field that we can't respond to. And from Moda Health, we should just that. So as an insurance carrier, we get these questions. We direct everybody back to the website and how to get connected. But it seems like that would be a theme that has been very consistent out in the field.
Thank you, Stacy. We have a lot of marketplace staff members here taking notes. So we may, while we may not have answers specifically right now, but
no,
definitely follow.
It's a theme.
That's great. Thank you. Oh,
yes. Can I just kind of follow Stacy? It would be very nice if we have agent portal that we can access to see clients' information and help them, because I work with a lot of English as a second language and they don't know this. I need to help them. And I would not be able to log into their website, right, because of the password security and such. It would be nice if we have agent portal to be able to assist them and see what's going on and see what they're talking about.
So to quickly answer, yes, there will be an agent portal. Okay. Jeff, do you know when we will be starting to train our agents and assisters on their various portal views?
Excuse me, on their, are you asking when they're going to go through the agent training?
Yes, agent training, the agent portal access.
Oh, the agent portal. Yeah, that's gonna be mid-July with everyone else, as far as I know.
Okay, thank you. And we have our Get Insured partners over here. They're nodding enthusiastically. Mm-hmm. So yes, that's happening.
Yes. Can I add just really quick? If you want a preview of what the portal looks like, we also had the listening sessions in January. So I can send Chicky the link to send out with or whoever sends out the follow-up, so that you can watch the recording of that too.
Thank you.
This is Kathleen
Kathleen.
Orak in the room. To follow question, as she serves non-English speaking populations, my question would be what type of interpretive services are being provided so that people have this in their own language?
Yes, so I will look to Amy, if you can provide those details.
Yeah, so our center will natively have Spanish speakers, but then we'll also have access to interpretation services and a whole slew. I don't know what the number is. Do you guys know?
It's almost 200 languages.
Yeah, 200 different languages. And then the system itself will be in English and Spanish natively, but then there will be, I believe, the Google Translate option available on the system too, which isn't perfect, but it will open the gate for people in a myriad of languages to access.
Will that be easily identified so that there's like a big button that they can just push and then select their language?
That's right.
Excellent. Thank you.
Matthew?
Matthew Woodbridge here in the room. Aside from HR1, it's something that I'd like to see emphasized in the training to support agents and assisters is a unit on like social determinants of health and cultural barriers to health insurance and understanding how to use it to help better educate our assistants and agents as they support these communities that have historically been underserved and had challenges in access. I think that'd be important to equip our agents with.
One last one. The other question that we're getting quite a bit throughout the state is kind of having some sort of what the support is going to look like for brokers as they're helping with their population that they serve and wanting to have like an escalated point of contact or whatever. It's been very challenging through the FFM, and there were concerns prior through Cover Oregon. And so that's why it's continuing to kind of be noisy. So just having some emphasis on like where they can get support or escalated support would be helpful.
Thank you, Stacey. Off the top of my head, I know there will be a dedicated line specifically for agents and assisters. Please don't ask me; I haven't memorized that number quite yet. It's newly purchased, if you will. So we definitely will have dedicated lines, and of course, we also have our dedicated liaisons within the program team for escalation, as well. So we hear you. We completely understand about the aches and pains with healthcare.gov and previously Cover Oregon, and we are definitely looking to not replicate those aches and pains. So thank you, Stacey. Is there anybody in the virtual room for any feedback? Or at least for the first question?
Yeah, I was going to nutshell Stacey's first question, like a quick answer, if that's okay.
Yeah.
So in terms of data migration as it relates to what agents would be concerned about, there is a plan in place, and I'm getting Shirt here to check me on the facts as I go, but basically we have always planned to migrate the data from healthcare.gov. The data that comes over will be people with active enrollment, so it's not everybody that's in the system, but just people that have plans at the time that migration happens. That will come with NPN information attached, and then it will be our job to, as the state partner, to match that up with our state NPN record. So essentially anybody that has an agent that already has a customer or client enrolled in a plan will continue that coverage as that person moves into 2027 coverage, assuming that coverage actually, that transition actually happens if they're able to renew or if they're determined eligible and make that process happen. So that's all part of the plan, and definitely something we didn't want to lose in that migration.
But that will be included in the training.
I certainly hope so.
I hope so too.
It makes sense if it was. And it would be sort of like unique to year one, obviously, because that's not something that's happening in that way in later years. But yes, that's something we should at least some facts to know in terms of the agent training.
Can I ask a question to Victor too? Again, Lindsay is on. So, I appreciate the data, migrate to agent. What about the clients? As I said, some non-English speaking immigration status, in the information transfer going to be, they don't have to submit their whatever visa or green card again, it will come through clearly?
I don't believe any documentation is coming over as part of that, and what that looks like is sort of shifting as we HR1 compliance as those requirements shift. So the client information will come over, the NPN attached to them will come over in terms of that validation of that additional information for things like immigration information. I think for year one, yeah, if you have some additional information, Jason.
Sure. Thanks, Victor. Jason Sparks from Get Insured. I'm in the room in Salem. So we will receive, as part of the data that we receive from healthcare.gov, at the individual member level, the individual enrollee level, verification information. So we will know that an individual, for example, has verified through the lawful presence verification service with the Department of Homeland Security, and in a non-2026 plan year, 2027 year, that would be it. We would know that that individual was had been verified as being lawfully present, and we would move on and renew them. As part of the HR1 changes and some of the pending rulemaking as well, there will be a requirement for us to re-verify lawful presence, as folks in the room know, for plan year 2027. So the short answer is yes, we will receive the information. The more complete answer is, although we will receive that information, we will still need to go through the re-verification process. And then what will happen is, if anybody is, for that subset of folks who are not able to be verified against the electronic data source, we will raise a data matching and consistency, similar to what healthcare.gov does. And you as the agent in your agent portal will be able to just look at the folks in your book of business who have data matching and consistency, so that you can focus in on those folks and helping them get those data matching and consistencies resolved before the end of their reasonable opportunity period. Does that answer the question?
Yeah.
Okay, great.
Okay. Time check real quick. We are at 9:38. However, there's very robust conversation, so we are plowing through some of the questions still. So if we can go back a couple of slides, please, to the marketplace training timeline. The next question is related to that, so just want to make sure you have that visual. So the question is, do you have any concerns with the key milestones in this timeline? Sorry, one more slide, please. And one more. As highlighted here, May is a train the trainer, which is actually in a couple of weeks. May is happening in a couple of weeks. We will be having the in-person and webinar training launch to marketplace grantees in July, with also, so it's marketplace grantees, assisters, and insurance agents in July, and then on-demand training in August. And the conclusion of the training season is 10/31, because, you know, we have to launch on 11/1. So high-level timeline, Matthew.
The main question I have with this timeline is in relation to the implementation timeline and the kind of finalization of the platform. It's pretty important that the training be on the finalized platform, because one thing that undermines confidence for the agent and assister community is repeated modifications to the training they receive. So just kind of double checking, I'm sure that's been taken into account. We've got a great team working on this, but I'd hate to see Jeff having to continuously send out updates to the training that we implemented, and the impact on confidence and certainty and the possibility for confusion in the agent and assister community. So.
Sure. No, it's a great question. Jason again, from Get Insured in the room in Salem. All of the core system functionality will be in place in June. So we're doing a June release, and the team will do user acceptance testing and other testing, and as has been discussed already this morning, stakeholder engagement as well, sort of partner engagement as well, I should say. I would say that part of the technology solution that we provide and that we've contracted with the state to provide is the system doesn't stand still. So we're continually looking at ways to improve the solution to make it better for you, for the folks you support, for all folks in Oregon who use it, which means that on a quarterly basis, essentially, we're introducing new enhancements and new features. And so what we've done historically.
I'm so sorry.
I'm just gonna leave the meeting. I'm so sorry.
So
Trying to do something helpful.
Thank you. So what we've done historically is partner with the state-based marketplace, or the other 9 states that we're supporting, to share documentation about what new enhancements are coming well in advance of that release, so that can get rolled out and shared with partners like yourself and the communities that you serve.
Great, thank you.
And I just have one question on the timeline. I think it's a clarification. So this is Stacy Carmichael in the room. The conclusion of the training season 1031, I just want to make sure I understand the launch on demand to the end. So my question is, if a broker wants to do a follow-up training, or maybe they missed something after 1031, would they have access to that on-demand training? That's just not clear really in the timeline.
Yeah, we continue the training continues to be available, especially because we know that there will be new insurance agents and assisters that onboard all the time. We put that conclusion of the training season because open enrollment, of course, starts November 1st, and we want to make sure that everyone gets trained before open enrollment. So it's kind of like there'll be a library.
Yeah, so they can go access it after.
Absolutely. We have a whole training platform that folks will
I
be
have
able to.
no concerns with the time.
I have a question, Sakina. Is this training, on demand or whatever, certify us to be able to write business, or we have to go to the marketplace to get the certification?
No, this
is just certified. Right?
So what you normally would have done with healthcare.gov, you would now do it with us.
Okay.
I see.
Okay, moving on to the next question, if we can go back to those question slides. So the question is, what channels do you think would work best for communicating training information to our intended audiences? We pretty much use all the channels. We use email, primarily email, of course, social media, text. We might include some pigeons there. I'm joking, but pretty much we identify the channel. We probably have thought about it, but is there anything that we may be missing? Yeah, Stacy.
So Stacy Carmichael in the room. And you don't have to answer this. This is something to take back and think about. But many of the carriers, we do trainings. We do our producer roadshow for small group and individual. Those tend to happen towards the end of August, but mostly September and October. My question is, would it make sense to maybe include something in our blasts out to training? So we send ours up to invite them to come. If we said, if you're interested in, the training for the Oregon marketplace, like here's where you go, or here's how you sign up. It's a question because I don't want us to be fielding any questions about this at all. But if we can help support getting the word out and getting people signed up, I definitely want to offer that. We can also include a slide in our deck when we do our live trainings. So you think about it.
I've thought about it and I'm answering, I would love to.
That's an amazing idea.
That's a great idea. So we will definitely, I'm looking at Katie Button and Anthony Behrens, who may or may not be in the room. So we will definitely reach out to our carrier reps to see what's the timeline for getting the content into the carrier roadshow, because I'm sure we can't
probably, but yeah.
So we will make sure we build that into our timeline. Thank you.
Hi, Matthew Woodbridge here in the room. In response to Stacy, from the agent side of things. So I will tell you that a couple of carriers consistently send a standalone reminder communication out to agents. Those are much appreciated. And I think that it shows that partnership and also increases confidence across the board.
Yeah, but they know what's
so I think that's a great idea.
Okay, carrier roadshow, check. I thought we thought of everything. So thank you, Stacy. Appreciate that very, very much. Virtual room, Ron, your hand is up.
Yeah, thank you. Some of the questions have been answered, but will the consent form that healthcare.gov has out there still be required? And if so, will it be streamlined? And these are questions I'm getting from other agents.
I believe the consent form is a requirement still. I think we would need to, yeah, it is a requirement. As far as if it will be streamlined, we are still looking at all of our partner tools to evaluate how we can update them. So more to come on that, Ron. Sorry, this is Amy in the room. You can't see me.
And then the next question is, if the transition doesn't go well for any reason, say agents are confused or insureds are confused, is there a contingency plan to maybe extend the open enrollment for those that struggle through this?
So Ron, this is Chicky. At this time, I don't believe so. We are pretty Stop it. We're confidence is a different story, but of course we are going to be implementing as best as we can. But we of course we can't control confusion, and we can't control different barriers to entry that folks might be experiencing. The open enrollment period is dictated by the federal government. So per rule, we are stuck to 11/1/2026 through 12/31/2026 at this time. Would we have an opportunity for special enrollment periods? We don't know. It really depends on the scenario. But at this time, open enrollment for plan year 2027 is 11/1 through 12/31 of this year only.
Okay. The next question is, what about the 1095s that people get every year? So for the 2026 1095s, will those need to be obtained through healthcare.gov or will it be our new system?
That will be, so again, this is Chicky in the room, that will be through healthcare.gov since enrollment was done through healthcare.gov.
Thank you.
Thanks, Ron. Okay, last two questions, if we are willing to still hang out with this agenda item. What would help organizations feel more confident going into training this transition year? We recognize this is a big year. We recognize it's not going to be easy. It's not going to be seamless. Anything that you think we may have not yet considered, please speak now, and please do not forever hold your peace, but please start now. Oh, Matthew.
Matthew Woodbridge here in the room. I think that one of the big pieces is the timeline. That early timeline is significantly different than what we saw with Cover Oregon, which is, I think, where a lot of PTSD exists in the agent and assistant community. I think we see evidence of that in the questions that we receive throughout this transition. So that timeline is aggressive, but I think pulling that off, having that implemented, having that finished product mid-year is huge in inspiring confidence. It leaves a lot of time for follow-up and questions from the agent assistant community. And I think that the way we respond to those follow-up questions and provide that support as we approach the go live date is one of the biggest things we can do to inspire confidence.
Thank you, Matthew.
Yeah, Sakina, I think not only the timeline is simplicity. If everything is simple, straightforward, 10 or 12 questions, boom, you got the health insurance. That's it. That will bring the confidence. Oh, I can do it. Normally, clients or consumer don't care what it is. It's a government or state. They just want to know that, how easy. I don't have to answer so many questions, and we don't have to spend a lot of time explaining. So that's what I'm looking for.
Noted, we are doing our best. We're trying to find that balance between requirements, which fields are mandatory, which ones are optional, especially with HR1 requirements and provisions, pretty much starting 1/1/2027. I can't promise. We're doing our best. It's not. No, I appreciate it. So we will try to make it as user-friendly as best as we can. These federal provisions are not the easiest to understand for sure. So. And we'll definitely open up opportunities, of course, for feedback. If you see something that you recommend we change, of course, we will always welcome those types of feedback.
And I do want to say we've put a lot of effort into like plain languaging the content and making it very user-friendly and easy to understand. So hopefully that will help as well.
I would say that within half an hour, we should wrap it up, with enrollment in simple case, something like that.
And that's Jason again in the room, consistent with what we see, folks in a simple case in the other states that we support, being able to go, end to end from starting the application, creating the account, starting the application, and completing enrollment in within that time period.
This is Kathleen in the room. I would also say in that, thought process of simplicity of enrollment, also simplicity of explanation of benefits so that they understand what they just purchased and can see it in a very visual way so that they understand what is and is not covered and what they're responsible for. Okay, Paul.
Hi, this is Paul in the room. I did want to note that, part of what we're discussing here, and one of the advantages of Oregon having its own state-based exchange is that we're still going to learn stuff this year. And the good news is that we'll at least have the option to change for next year and the year after and not sort of be trapped in the same space. Like, it's both having it and the fact that we do get to live and learn with it that is the win.
Thank you, Paul. We appreciate that. We, as you've known from us for the last couple of years, we're very excited with that flexibility. We, as Misty noted in the chat, we have had the community partner assistant training for the last 8 years. We took that over from healthcare.gov for a variety of different reasons. We're pretty excited to take over the agent training as well from healthcare.gov as part of our transition. But again, noting that we won't know everything. It won't be super seamless or super smooth, but please know our doors are always open virtually. Again, text, email, carrier roadshows, pigeon, however you want to send us a message, please send them our way, and we will make sure to log in and figure out how to build that into our future iterations. Okay, so I think
Ron's got a question.
Oh, Ron. Yes, Ron.
Yeah, I want to go back. I think I heard earlier that the intent is to transfer each insured's data to our Oregon system from healthcare.gov. I heard the word intent, but is there a timeline when we know we'll be able to do that or not?
Go ahead, Jason.
Sure. Thanks, Ron. Jason in the room again from Get Insured. So Oregon will be our 10th state that we've taken through this data migration process. And I think we can say with confidence that we'll be able, together with the Oregon team and our federal partners, to receive the data. Essentially, the very quick overview is we test repeatedly before we get to go live. And so we'll receive a full set of data from our partners at healthcare.gov in May, so next month, actually. And we'll take that through the entire data migration and also the auto renewal process. That gives us a chance to identify any issues with the data, ensure that all of the processes that we've previously used continue to work, gives us time if we need to make any changes to make those changes before we get our next set of data in the July-August timeframe. And we continue to iterate on that and make any changes, work with federal partners with respect to any data issues, all the way up to September when we run our production data migration and auto renewal processes. So it's both intent and a commitment to migrate all of that data successfully. What we've seen is, and what we aim for is sort of north of 99% of folks that are in the healthcare.gov data being successfully automatically migrated. Of course, that leaves about 1%. So we have contingency plans and processes to address that population of folks that cannot be migrated through the automated processes that we have, in addition to supporting the exchange team with outreach and other activities to make sure that whether those are consumers or brokers, agents that are not migrated, that we're engaging with them and supporting them through that migration process. What brokers agents should expect is that you will receive a invitation prior to go live with a link, a unique link for yourself that gives you access to your agent portal. And in your agent portal, you'll be able to view your book of business that we migrated from healthcare.gov. And then as Chicky noted, that dedicated contact center phone line for brokers and assisters. If you find that there are, folks that should be in your book that you're not seeing, we're there to support you in helping to make those connections.
Thank you.
Ron, does that help answer the question?
It does. Thank you.
So just to follow up on providing credibility and including into the training, is that including what Jason just mentioned about it being their 10th state? We work with Get Insured through Your Health Idaho. So when we get questions from brokers, we immediately say that and it goes well. And they're like, oh, you can see the relief. So I was not aware that there was 10 states, but I do feel like talking just a little bit about that at the beginning will put some of the concerns and just the misinformation to bed would be helpful in the training. And then I wanted to kind of go back to the question on the open enrollment dates real quick, Chiki. My question, and I'm not an expert, so please no judgment here, but while I understand the federal guidelines do set a lot of the rules, in Idaho, it is a 10-15 date. So I don't understand, is that a state, like, does the state have the ability to influence our dates? It's a question.
So this is Chicky. So the guideline from the feds, I believe this is the program integrity rule from last year. And the guideline is no later, that open enrollment doesn't start no later than 11/1 and doesn't end no later than 12/31. So Idaho has chose to end it sooner. We are choosing to hold it until the very last day.
Okay. So we could change it.
We could change it. We could make it sooner.
That doesn't help.
No, but
this question.
With the first open enrollment, we are definitely going to maximize our time.
Sure. Okay.
And I believe there is a guideline that it has to be bound to a certain amount of time too.
Which makes sense. Because I think it's 10-15 to 12-15 or something like that. Okay.
Will there also be a significant event enrollment for people, like if they retire in that year?
So for that, those are qualifying life events, and those would trigger the special enrollment periods, which we would operationalize in our system, starting with the plan year 2027. Okay, we are at 9:59. Thank you so much for all your feedback. I think if that's okay, I will reserve the last question. So the last question is, which barriers should we consider that make training difficult to access, complete, or use effectively? If you have any thoughts on that, so please think about format. So for example, on demand, we're offering virtual, in-person, in English, and in Spanish. Other barriers to accessing the training. So if it's technology, hopefully we will, our team, we're hitting the ground, we're hitting the road this summer. So we will be providing in-person opportunities throughout the state. So just, if you can think of other potential barriers, please let us know and we will put those into consideration to our plan. Okay, I'm sorry to rush us through to that last question, but this was very, very helpful. Jeff, before we turn it over to the next agenda item, Jeff Wilcox, let me know if there's anything else you want to cover at this time.
I don't, other than to say that we're really listening to feedback. We want the training to be as easily consumable as possible. And that's our ultimate goal. So we're doing our best to be as responsive to our clients as we possibly can. We want to make sure this goes smoothly as we can possibly make it.
Thank you, Jeff. Okay, so here in the slide in front of you, our partners in Get Insured, again, as mentioned earlier, have years and years and years of experience, at least 10 years with various states. So you have this slide in front of you. And we have in the room with us today, Jason Sparks and Claire Howderman. Thank you very much. I'm having a hard time with last names today, but please join me in welcoming them. And so please take the mic.
Yeah, it's great to meet all of you. I know we've talked a little bit in person or over the phone a couple months ago, but it's great to be able to be with you all. And we've had a wonderful time We know from our past implementations, those are the trickiest things to do. It takes a lot of time for us to understand what you all are looking for in a system. And the OHIM team has been so incredibly diligent in terms of working with us so closely to get that information set. So big shout out to Amy for working with us on the content. We tried a couple different approaches this year just because we know it's a large bundle of work to look at, and really appreciate the feedback Amy has been able to provide, not only on the actual content, but the way that we're working with you all to get that content and to continue to make it improve it for the system to come. I think too, on the configuration side, I know there's folks in the room that have touched us and touched the platform in other stages, which is really exciting. You will see differences because of the lovely things that Oregon wants to do. And that was the dedication that the team did to really configure and tell us how they want the configuration set for the system. So what we're doing right now is we have the ability, since you all were able to complete your homework assignment so early, to get those systems ready for UAT. We'll see the team back in May to begin that work, and that will be a focused time frame for our OHIM friends to really see what that baseline product looks like in order to have the time to make changes, again, for a September-ish release ahead of go live. I know Paul did a great job summarizing it, but yes, this is just the beginning. We want to make sure that the system is right for you all to begin, but then we'll have the ability each quarter to continue to build upon it. And that's with what our product team is able to create, but what you all are able to think through. And I think going back to just some of the configurations and content, the enhancements that y'all have talked through are so thoughtful. I know there was one in particular for Find Local Assistance, and it came from agent and assister conversations to just remind folks that even if they have agents found in a certain area, to go find and see if there's other resources available in terms of assisters. I know our product VP was just like, oh yeah, why wouldn't we include language to remind folks to see who else can help them? And so just want to give another shout out to the creativity and also the commitment to accessibility that y'all have already demonstrated. The one thing that I wanted to add on, and I know we started to chat through it, is a usability group. I know we've done something similar in a different state, but what you all have looked for and what we were able to start to have conversations around is a group that would be dedicated to really assessing the system a little bit earlier than others. So we're working with Victor now just to figure out and solidify the timing around that, as well as the members that would be a part of it. So this would be a small group of agents and assisters, other partners in y'all's community that OHIM decides makes sense to just test the system and specific scenarios ahead of when training would be rolled out. I think this will give you all an opportunity to be able to see the platform a little bit earlier, allow us to take that feedback back with OHIM and assess what makes sense to include and how can we get that included in y'all's platform. So I think more to come there. I know Victor and I have just started conversations, but I think that would be a June-ish, late May, June activity for you all to start to think through, which will help us to solidify that platform. I think those are the big items that I wanted to hit on. The last one is just HR1. This is a big one still. I know that this is the marketplace, but this still impacts how we operate. And it's been really great to be able to connect with the OHP friends to make sure that we're in lockstep in terms of what this will look like. We share consumers. We share consumers with them a lot. These are the same folks accessing Medicaid as they are marketplace, sometimes month to month. And so being able to work with them to make sure that we're communicating clearly will help us to continue the ACA's goal of one door, come on in and we'll help you with an application and get you enrolled. So excited to continue those conversations. I know we have some certain capabilities too that we would love to continue to chat through with OHIM and then in turn OHP just to see how we can improve this. But again, this is just the beginning. And so those conversations can continue to make sure we're all on the same page and moving in a way that is beneficial not only to consumers, but also agency goals. So really in sum, it's been a delight. We're so excited. I know we've kept the team busy, but this is just the beginning. And so we're ready for a busy summer. I know Tricky early on said, no vacation. And so
did I say that? I did not say it in this meeting, by the way.
she did not say it in this meeting. She did say it, maybe hint to OMT. So we will see folks all summer to be able to really make sure that this platform works, and then are excited to see you all in the fall. But thanks for letting us be here. Anything else to add?
Just briefly, thanks, Claire. Well, very well said. Jason, again in the room. Sort of Claire's observations about the partnership and the collaboration with the OHIM team. These implementations are sort of made or broken in those, in the weeds, in those conversations, and I think our experience has been when there's an exchange team like the one that Chicky's developed, that has deep experience both on the policy side, on the operations side, and is getting there now on the technology side as well. That we're able to get what we see is much faster decision making, which allows us, as Claire noted, to be able to deliver a platform that's testable and user ready more quickly, and that gives us just more runway and more time for all of the testing, for the demonstrations that we have to do with our federal partners at CMS, so just the partnership's been exceptional, and there's so much knowledge on this team that we're really grateful for. Every implementation so this is the 6th state that I've helped to take live in the past, from the FFM to state-based marketplace, or from an existing system vendor to our solution in the past 5 years. And we've been able to deliver each of those on time in partnership with with the state-based marketplace team that we're supporting. We are I think we've heard in the room today the importance of instilling and building confidence with everybody that the folks in this room work with, and with people in Oregon in general. We take that, we've internalized that as part of our mission in this implementation. We obviously know the history here, and so we've got our experience and our team to rely on, but we're not sort of standing still. We're making sure that we're doing everything that we need to do to make this as low risk of a project as we can. And again, appreciate Chicky and the team's again, thoughtful decision making about, this is what we need for year one. We can do X, Y, and Z in a subsequent year to avoid introducing unnecessary risk in the initial implementation. And that's been a really thoughtful set of conversations. So thank you again for allowing us to be here, and look forward to the continued collaboration and feedback that we know that we'll get from this team.
Okay, thank you, Jason. Thank you, Claire. As they said, we are just getting started, and Marketplace TV totally can take vacations. We just need to.
I know.
I have 2.5
You do.
We just need to negotiate when and where, and not everybody at the same time.
There, she said put the vacations on the calendar early.
Yes,
Not
that's true.
She was ready.
Let's talk about that. Okay, you all are making me sound like a really tough boss. But thank you very much for the thorough and robust conversation. Lindsay, I think if I can pass the mic back to you to get us back on the agenda.
I think we're probably headed first to public comment, just given we're sort of closest to that. So, and then we'll come back to federal development. So I just wondered, Dawn, if anyone has signed up for public comment, or if anyone online wishes to raise their hand for that.
No, there isn't anybody signed up for public comment.
Okay, just want to give folks a minute in case a member of the public wants to contribute.
Sorry, Lindsay, I was looking. We do have a couple members of the public in the room, so I was just.
Great.
Yep, I'm just saying hello. I haven't introduced myself, but just also checking if they wanted to provide.
Great, please. I'm sorry, I can't see y'all.
That's okay. They're also kind of away from the camera and they shook their heads. No.
No. Okay. Well, then I think we could move forward, Chicky, and do these updates and then push the break. Is that what you're thinking?
Yes, please. And then also reminding folks in the room, please feel free, don't wait for the break if you need your own personal break. And then we also have refreshments at the side of the room. So please get up and move around as you best see fit.
Got it. Okay. Thanks everyone for your flexibility. Really appreciate the engagement. Victor and Katie, I think it's to you.
Good morning, everybody. I'm Katie Button. I use she, her pronouns. I'm the plan management policy advisor for the marketplace. I'm gonna let Victor take a break because he's been doing a lot of presenting about SBM, but he is free to jump in with any additional things that he would like to talk about. Today, we're going to talk about how federal changes impact the marketplace. These are mostly out of HR1, the program integrity rule that came out last summer, and the proposed 2027 notice of benefit and payment parameters, otherwise known as the payment notice. On the bottom of each slide is where these provisions come from. So I'm not going to say that because I don't want to have to repeat payment notice 175 times. So away we go. So the first change is in premium tax credit eligibility. There is a new part of the rule that only folks non-citizens who meet the definition of eligible alien will be eligible for tax credits. So generally, green card holders, Cuban and Haitian immigrants, and people living in the U.S. under the Compact of Free Association or COFA will be eligible. Asylees and refugees will generally not be eligible. So the Get Insured team is currently making updates to the eligibility engine so that those immigration statuses are reflected correctly. And then we will work with our agents and our community partners to make sure that they know what immigration statuses qualify and what documentation folks will need to provide. And then we'll provide information to the public on that. Next slide, please. There are some changes to standard plans. The note for Oregon is that there is no change because we have our own standard plans. So we'll continue to have standard plans and we will offer those as normal, and then carriers will also be able to offer non-standard plans as normal. Next slide, please. Oh, thank you, Amy, for the note. Sorry, interpreters. I am a very fast talker. I will take a moment. Don usually gives me the sign. So there are some plan changes headed our way. The first is there is a proposed expansion of the hardship exemption. And so that would be for anyone who is ineligible for cost sharing reductions or tax credits. So basically anyone over 250% of the federal poverty level. The hardship exemption allows people to enroll in a catastrophic plan if there is one. We have not had catastrophic plans for several years. We don't know what the carriers will file this year, but we don't anticipate we will have catastrophic plans. So if folks apply for the hardship exemption and are granted the hardship exemption, there's not really a benefit if there are no catastrophic plans. We will use healthcare.gov to process the hardship exemptions, and we will make sure that we provide information to our agents and our community partners and the public on that. Next slide, please. So bronze and catastrophic plans have been hard to design because of the actuarial value or AV calculators. So there's a proposed provision that would allow carriers and states like us who design our own standard plans to increase the maximum out-of-pocket over the maximum max out-of-pocket amount to decrease other cost-sharing amounts and basically not use the AV calculator. There's not a lot of information about how this would work. Oregon was able to design the standard bronze plan using the AV calculator this year, but carriers may choose to take advantage of that flexibility with their plans. In addition, catastrophic plans can be offered for multiple year terms. Again, there's not a lot about what this really means. And so since we don't have catastrophic plans and we don't anticipate carriers will offer them, we don't think that that will probably be something that you'll see in the Oregon market. So our impact is unknown because we don't have plan filings yet. Next slide, please. So in plan certification, one of the things that the carriers have to do is submit quality improvement strategies. So these are strategies that they design and implement to improve quality in their plans. There is currently a requirement that one of the topic areas they must address is reducing health and healthcare disparities, and that is proposed to be removed in the payment notice. We have our own form in Oregon, and so we will still require carriers to submit that topic area. They've been doing that for the last few years, so it wouldn't be a change for them. So hopefully it's not a big deal for them to continue to report on that topic area. Next slide, please. So there will be some additional verifications for consumers starting in 2027. The first one is income verification. Currently, if the income reported on the application doesn't match the IRS, the person can attest that, yes, that's my income. This will revert back to older policy where if the person's income was different by enough from what the IRS had, that the person would have to submit additional documentation, could be pay stubs, things like that, to show that, yes, this is my actual income and yes, it is different from last year. So that will be something folks will need to do. So Get Insured will be probably reverting back to that old code that they already have. And then we'll have training for our community partners and agents and extra communication to the public so that they're ready when they apply with any income information that they'll need to provide. Next slide, please. So failure to reconcile is a term that is used for when folks have not filed their taxes and have not adequately said, yes, I got these amount of tax credits. Currently, folks have 2 years that they cannot pay their taxes and not reconcile their tax credits and still be eligible for tax credits. And that's going to go down to 1 year. As an SBM, we get to choose whether we implement it in 27 or 28. So we have chosen to implement it in 2028. So starting in 2028, consumers who have not reconciled their taxes in the past year will have to complete that before they can be eligible for tax credits. So Get Insured will be updating their system so that that will be ready. We'll train our agents and community partners and put out information for the public. Next slide, please. One of the big changes coming in 2028 is that there will be no auto re-enrollment in the way that we know it now. There will be some sort of verification that's required. CMS has not put out information on that. So we are trying to guess. Get Insured is trying to guess on what that might look like. And we are hoping that we will be able to do it in a way that's not too hard for consumers to come in and say, yep, that's still me. Yes, that information is still correct. And then after they've verified their information, they could still use auto enrollment if they want to. Currently, we have about 30% of our folks come through via auto enrollment every year. So we want to make sure that we're still providing that path for folks. So that will be a system update once we know from CMS what that looks like, and then training for community partners and public information. Next slide, please. A big change that's coming for the marketplace staff will be the State Exchange Improper Payment Measurement Program. So this is an audit from CMS where the state has to prove that we have calculated APTC correctly and are administering it correctly. It's going to require a lot of reporting, probably manual reporting. So we'll be working with Get Insured to see if there's any automated reports that they can help us with, and then we'll be allocating staff time to complete that reporting. That is federal changes. Do you have any questions?
Matthew Woodbridge here in the room. The income verification piece has historically been a variance of about 20%. Is that continuing forward at the same level?
Yes, I believe that the variance is the same as it used to be.
Okay, thank you.
Charlie in the room with Osberg. I'm assuming the answer is no. You didn't say it, but on the bronze plan AB, is there anything we can do about that at the state level to make sure that people aren't having the opportunity to enroll in really high deductible plans?
We could theoretically, in general, I will say I think our carriers do a really good job of squeezing every bit out of the AB on the bronze plans. We have a lot of bronze plans that have pre-deductible coverage. A lot of them have $3, $5 office visits. And in general, I like to call them the traditional high deductible health plans, which were what folks could use to contribute to a health savings account. Those are there, but they're mostly for that particular purpose. And otherwise, all of our plans are really good at providing that coverage. And so the idea is that you could increase the maximum amount of pockets so you could drop the other costs more. So theoretically, a carrier could decide to take up that maximum amount of pocket and provide more pre-deductible coverage, in which case a person's unlikely to reach that maximum amount of pocket. But it's so new and very not, it's not well and explained how it should function. So we don't know if carriers will do it. Carriers file their plans the first week of June this year. So, or I think June 10th, excuse me. So once we have plans filed, then we can, look into that and see kind of what folks are thinking about for plan offerings.
So theoretically, we do have some authority. We just don't know exactly what we would be regulating by
yes.
So,
yes.
Okay. Got it. Another question on the auto enrollment. Can we just a thought? Can we have people opt in to auto enrollment? Is that an option? When they're signing up, we say here's a little box that they check and say, please sign me up every year. So it's not quite auto enrollment, but it's
They already do that, and that allows us to check the IRS so that we can have accurate income for them. And so again, CMS hasn't said. It could be as simple as, hi, Katie Button, are you still Katie Button? Do you still live here? And I could say yes, and then it could be verified. We don't know. We're hoping that it will be something easy like that, and then processes will function as normal.
It's great that we're getting so much time.
Yeah, they've had multiple opportunities to put out more information and have not, which is extra difficult for us.
Katie, I have a question.
Yes.
Sakina in the room. I'm kind of lost on the possibility to have catastrophic plan for people who over 200% with a financial hardship. Is the premium going to be lower for this plan?
So I like to call it an insurance urban legend that catastrophic plans are cheaper. When we did have them, they were literally $1 cheaper. I did a quick comparison of 5 major cities across the country. Only one had bronze plans that were more expensive. And those were for catastrophic plans that were just for people who were under 30. So I find it highly unlikely that carriers would be able to offer catastrophic plans with premiums that were much cheaper than bronze, if at all.
I think most people, I don't know, I don't see the demographic clearly, haven't looked into my fault. But looking to this, people who will enroll going to be people who older. And if you compare the premium they pay and the over 10,000 out of pocket, I think we create something that people are not going to go see the doctor and wait until at the end. So I'm kind of like go against it, because in those cases, people rather just save the money and just go see the doctor directly, be in debt for whatever and get the financial assistance from the nonprofit hospital. I would like to see some actually lower deductible, lower out of pocket, because I hear from the consumer, I'm willing to pay because I'm getting older. And they keep reminding me that they're getting older, I'm getting older too, right? So I'd rather pay to have it covered when something happens. So that's the comments from the consumers.
Thank you. Go ahead, Claire.
Thanks. This is Claire Pierce-Roll with OHA, Health Policy and Analytics Director, and it's something Charlie said and then departed for a second. Reminded me, I just wanted to say, I think out loud and validate that the OHA approach across the board is to seek policy flexibility with regards to implementing the HR1 changes, to be able to keep people covered, make the process and additional administrative hoops that folks are going to have to go through to maintain coverage that they are eligible for, or financial assistance that they're eligible for, as easy as possible. And that's really our North Star. And one of the things that makes that incredibly challenging is the timeline by which we are getting clear guidance from the federal government. We are really not set up for success. This is, not in the marketplace category, but kind of looking at Medicaid, for instance, the work requirements that are going into effect January 1st of next year. We are not expecting the proposed rules around that until June. And we are needing to build our systems in that way. And it's just not something that will be, it's not setting us up for success. I think the marketplace, we are in a really good spot and have really good partners in place. But as Katie mentioned, even the kind of understanding of what our flexibilities are dependent on the federal government giving us guidance. But again, just to end where I started, that's what we are thinking about every single day, is building out the systems to the best we can and assuring that we will be looking at every possible turn for the flexibilities to make sure that we are keeping folks coverage, keeping coverage affordable.
Thank you, Claire. Lindsay, I think I did a quick look around the physical room. It looks like hands are good.
And I don't see hands online. We are good to proceed. Yep. Okay, we already did public comment. Okay. Chicky, what are you wanting to do for break for folks online? Do you just want us to self-manage and keep going here, or what's best?
Chicky would like to defer to the people in the room. I mean, I would like to not make a decision, but I feel like, should we power through? And folks, again, to Lindsay's point, self-manage their breaks. So to get us back on track with the agenda. Okay, so lots of nods in the physical room. I would imagine off camera and on camera, you might also have been nodding. So executive decision for us. Let's power through.
Great. Okay, then let's move forward to OHPB, please.
Thanks very much. This is Bill Kramer, member of the Oregon Health Policy Board, and I want to thank Lindsay and Chiki for the opportunity to provide a brief update on the Oregon Health Policy Board's current activities and future plans and how they relate to the marketplace's work. As you know, OHPB is charged with overseeing health policy for the state and working with the Oregon Health Authority. And we see the marketplace as one of the cornerstones of our state's commitment to providing affordable, high quality, and accessible health coverage to Oregonians. We also recognize that the marketplace is facing many challenges, especially due to the challenges and pressures from the federal government, kinds of things that Claire was referring to, that's causing coverage in the marketplace. We do rely on the advisory committee to help navigate these challenges by providing your advice and guidance. We really value your input. So the Oregon Health Policy Board, as you probably know, has a wide range of issues that we engage with, including the Oregon Health Plan, behavioral health services, health equity initiatives, and many others. I serve as a liaison from the Oregon Health Policy Board to this advisory committee. As some of you may know, I was involved in the concept and the design of the marketplace from the very beginning, and it's been great to see the success of the marketplace in recent years. For the current year, the Health Policy Board, in consultation with the Governor's Office and OHA leadership, identified two major priorities. One is affordability, and the other primary care. So I'll talk about each of those. The Affordability Initiative was launched last year in recognition of the healthcare affordability crisis that the state faces. As you know, many Oregonians simply can't afford to even purchase health benefits. And even if they do, they face financial obstacles that cause them to defer needed care or skip medications, which is just intolerable. We formed an affordability committee that is charged with developing policy recommendations to address the affordability crisis. We've asked the committee to develop both short-term and long-term recommendations. And we've also asked the committee to develop recommendations that both protect consumers from high costs and recommendations that address the root causes of the high costs in the healthcare system. We've also formed an industry advisory committee consisting of representatives from hospitals, health plans, health systems, physician groups, and so on. And they will be providing input to the Affordability Committee to ensure that the industry's perspective and ideas are heard. The process is the Affordability Committee will be presenting its report to the OHPB this summer. The Health Policy Board will then choose which of these recommendations to move forward, then work with Health Authority, the Governor's Office, and the legislature to turn these proposals into legislation or executive action. We expect the Affordability Committee to continue its work going forward, since we recognize that it will take sustained effort to actually improve affordability in Oregonians. This is a big challenge, but the committee seems to be willing to take this on and has been working diligently, getting educated, looking at initiatives other states have undertaken, assessing the impact and the viability of those ideas for Oregon. As I mentioned, the second initiative for this year is primary care. This was launched this year in recognition of the crisis facing primary workforce shortages and stresses on providers. So we have formed a primary care strategy committee that's charged with developing innovative solutions for a strong primary care system, focusing on payment and affordability, workforce, and the delivery system. The committee, newly formed, consists of 18 members, includes representatives of primary care provider groups, patient groups, CCOs, and 2 members of the state legislature. The first meeting of the group will be on April 28th, and there's a pre-meeting, an educational webinar on April 20th. And last but certainly not least, the OHPB continues to be very interested in continuing its work with the marketplace. Chiki provided an excellent update on the marketplace's activities and challenges at the Health Policy Board's March meeting. And looking ahead, we'd like to work with the marketplace as it develops its strategic plan over the next several months. So as you know, as we transition to the state-based marketplace and address the challenges from the federal policy changes, it'll be important for the marketplace to have a clear vision and a plan to achieve it. And the Health Policy Board would like to provide support to that effort. So that covers highlights of what the Health Policy Board's involved in, and I'd be happy to hear any comments, respond to any questions you might have.
Thank you very much, Bill. Let me look at the.
Sorry, Lindsay.
Oh,
yep. I was going to say we have two hands immediately popped up.
Please do it.
Okay, we'll start with Stacy, and then we'll go with Kathleen.
Okay, so Stacy Carmichael in the room. I'm really excited about the work that you're doing and your board is working on. I'm concerned about the decline of enrollment into, and that's why I think it's great that we're updating each other, because all of our work is kind of all interconnected. And I suspect a lot of this is around affordability is the main driver. So I'm really interested in getting more updates about what the work that's being done on the affordability work group, or if I'm calling it out the correct name, sorry. So anyways, I just want to say I appreciate it. I'm very interested in it. And I think it directly impacts the work that our committee is doing.
Great. Thanks, Stacy, for that comment. There's information about the committee's work on the OHA website. If you just you search for Oregon Healthcare Affordability Committee, you'll find it. It's got meeting minutes. It's got the charter for the group and the composition of the roster for the Affordability Committee, so you can see who's on it. And a lot of the work that's been done so far is called educational. There's been discussion in the group, but it's more about trying to understand what are the and then what has Oregon done to address this up to so far, and things like the cost growth target program, the healthcare market oversight program, and also what other states have done, what kind of steps they've taken. So, and they've been trying to prioritize those so I can come up with some recommendations. In this next meeting, they've said, okay, we've gotten educated. Thanks for all the education stuff. We really need to discuss and hash these out now. So this is going to be really sinking their teeth into all that they've learned over the last few months.
Thank you, Bill. Kathleen?
This is Kathleen in the room. I'm very interested in your primary care strategy committee. Primarily because what I am seeing is that, people are limiting signing on because of the affordability. And then they limit accessing care because primary care is difficult to access. But now when the consumer does go to primary care, those providers have such a compressed template for how many patients they can see in a day, and the payers or the organizations are putting a lot of pressure on the providers to stay within a specific timeline of how much time they're going to give a new patient, or to address questions that as patients are coming to access care, they're being given the opportunity to discuss one, maybe two issues, whereas they've already delayed care and they may have 5 issues that they need to discuss. But now they're out of pocket again for another copay to come back at another time that now pushes and delays the care even further. And depending on what the issues may be with that patient, we may just be compounding the medical complexity of that patient, which now results in an admission to a hospital. So I hope those types of scenarios are being discussed in your strategy group.
Yes, very much so. And Kathleen, thanks for raising all those issues. You're absolutely right. We have a systemic problem in primary care right from the beginning. Affordability, barriers to even enrolling in a health plan. Even if you've enrolled, getting access to a primary care provider, there are often long waits to even get to see a provider. And then when you get to see a provider, they've only got 15 or 20 minutes to see them because of the pressures they're under their workplace. And there are a lot of heavy administrative requirements, reporting requirements on primary care providers. We need to look at payment issues. So it's a deep and systemic problem. It's not open. It's not likely to be fixed overnight, but we need to start working on it. Oregon has invested more in primary care in terms of amount of money being spent, still not getting the results we want in terms of improved access and improved care for patients and a better work life for primary care physicians. So thank you for raising those issues. That's exactly the agenda that they're working on. And I know this group is very eager to get going on this. The leader from the Oregon Health Policy Board on this, somebody probably knows, Dr. Tony German, who's a primary care physician himself. And this is one of his passions, and he really is trying to work with this committee to move it forward. Also developing, like the Affordability Committee, developing recommendations that would go to working with the governor and the health authority and the legislature to develop either executive actions or legislation that could begin to address this crisis.
Thank you.
Chicky, can I have a question? Hi, Bill. It's Kenai in the room. In regard to primary care doctor, have you talked to the insurance companies for their credentials? Do they have to be MD, DO? Can NP, PA can be a primary care doctor? That can solve a lot of problems, especially most of the some demographic like to go see naturopath, but some insurance company don't allow them to be PCP.
Yeah, I think that is one of the issues. We know part of the problem here is just not enough primary care providers, and expanding the workforce, both for physician level, but also for mid-level providers. I think it makes a lot of sense, and I think working with the health plans to expand this, looking at licensure requirements, is one of the items that this committee will be taking up.
Thank you.
Thank you, Bill. So just as a quick note, I'm hearing a lot of interest in these two committees subcommittees of the Oregon Health Policy Board. The Marketplace team will make sure to monitor these two committees and provide information as we have them, especially meeting announcements and so on and so forth, just so that we can be extra sure. I'm sure you can also sign up for the updates, but we'll also make sure to send them your way so that, especially if there are specific topics of interest for you, that you can flag it for maybe your schedules to be able to join those sessions.
Great. Thanks again for the opportunity to provide the update, and thanks for the great working relationship between Health Policy Board and the Marketplace and this advisory committee. Really appreciate your comments and questions.
Thanks very much for being here. Appreciate it. Okay, I think we are headed to Chicky. I think you're giving a PHP update.
Okay, so again, Chicky Flowers, Director of the Oregon Health Insurance Marketplace in the room. So you may or may not be aware, but on March 19th, Providence announced and sent out a press release that they are actively exploring strategic options for Providence Health Plan, including the sale of the plan. So what this means for us right now is there is no impact to 2026 Marketplace coverage as a result of that press release and that announcement in mid-March. Individuals enrolled in Providence Health Plan coverage through the Marketplace can expect that their 2026 coverage will continue with no disruption to benefits or access to care. And of course, we will continue to support stable, reliable coverage options for people in Oregon, and we'll ensure consumers have the information that they need. Now, that's this year. Looking ahead to 2027, plan year participation for Providence Health Plan has not yet been determined and will be finalized as part of the annual Division of Financial Regulation rate review process and the Marketplace's plan certification process, which has unofficially started and will really ramp up starting in May. Of course, we will share updates as we have them, hopefully as close to real time as possible, and definitely leading up to open enrollment for 2027 once we know which plans are participating and confirmed for the 2027 plan year. Please know we are dedicated, and of course, in partnership with the Division of Financial Regulation, we will continue to work. And of course, our fantastic carriers. We've had really dedicated carriers for many, many years now. We will continue to have multiple coverage options available through the Marketplace, regardless of future changes with Providence Health Plan. So again, no immediate action is required at this time for 2026. 2027 future with Providence Health Plan on the Marketplace is still to be determined. So quick and dirty, high level update. It is only April 16th. We have not heard any additional updates at this time. But of course, once we know and hear more updates regarding 2027 participation, that will definitely be a topic for future consideration and conversation, especially in July, because come July, we typically invite the Division of Financial Regulation to give an overview of what 2027 can look like.
I just have a quick question.
Yes.
Did you really not know if a carrier is participating or not based on their filing? So like, I think it's June 3rd, but I mean, is that really like, if we don't file, you're like, oh, they're not participating. Is that really how you'd find out? I'm confused. I mean, don't take that the wrong way, because I know a lot of people are giggling at me, but like, I really don't understand.
That is the most formal of steps,
okay,
for sure.
Okay.
But I will look up to Katie to make sure if there's inside baseball.
So we have two ways. So we have the request for applications, which is how carriers let us know that they want to participate.
Okay.
And so, so we get that. And then generally carriers will give us a heads up, like, hey, we're going to add a new network, or we're going to pull back a network. So they talk to us a lot, but but like with the catastrophic plans, if carriers are doing that, they're keeping it real quiet. And so I won't see it until they actually file their plans.
Right.
And so that's kind of where we are. And then also, when things are moving behind the scenes and maybe carriers don't have, they don't know what they're going to do, but that deadline is coming, that is kind of the indicator. If they haven't done something by a deadline, then that, then they're not going to do it, kind of thing.
But please know, we are very much in communication and coordination with Providence Health Plan. They have been really fantastic in making sure that they send us updates as they have them and can share with us. They are also active and currently still active, because they're active in 2026, active as part of our state-based marketplace transition activities. So it's, at this point in time, we are assuming any possibility with Providence.
Matthew
Matt?
Woodbridge here in the room. Do we know if they have received any interest?
I don't believe we know that.
Okay, thank you.
Thank you.
And presumably, they would have to go through the healthcare market oversight program.
Particularly for their sale, they would have to go through the Division of Financial Regulation for sure with the insurance commissioner. I think TK was here earlier, but he probably had to drop off. But I think we would be happy to maybe invite DFR to provide more insight into that maybe at the next meeting. Yes,
I think your question, Charles, this is Claire Purcell, was specific to the healthcare market oversight program, and it would depend on the transaction. So it depends on the details of what they would ultimately propose and whether that would be subject to the healthcare market oversight program review.
But I guess if they had interest in the sense of being sold to someone, that transaction presumably could.
Since it would be dependent on both entities that are involved in the transaction, so that's kind of the time that would be determinative for that process.
Right. I guess I'm just assuming that the two parties would be large enough, but you're right.
No more questions or comments in the room, Lindsay. And I am doing a quick look in the virtual room.
I think we're good.
Okay.
Let's move on. Thanks for that update. So now I think we're headed to the workshop, and just a heads up, we will see how time goes in terms of managing lunch in the room and virtually, but again, appreciate everybody's flexibility. Amy, you want to take it away?
Absolutely, thank you. Hello, everyone. Amy Coven here. I'm in the room, she, her pronouns, and I am the communications and public engagement analyst for the marketplace. Great to see a lot of you in person. So I am excited to be here to talk to you once again about the rollout of our state-based marketplace brand, which, as you know, we've chosen Explore Health. And so wanted to talk to you a little bit about kind of what our plans are that we have in the works, and then really get some feedback from you all. It's, you know, as you know, partner engagement and getting feedback from our communities is really important as we go through and plan this process. And so want to make sure that I'm not leaving any stone unturned or missing any important aspects or anything that as we continue to plan the rollout of our brand. I'm really excited that we're at this stage. So just as a reminder, we do have our OregonHealthcare.gov website, which is not going away. I am currently in process. I'm really excited to say I'm really working on a project with in collaboration with the Medicaid side of things, as well as folks over at ODHS for Medicare, and then ODBA and DCBS. To really go through OregonHealthcare.gov and re-envision it as more of a centralized hub for health coverage information, so that folks can go there and kind of, it truly is a one-stop shop. So we're in the process of that right now. And so what we're looking at is we'll have kind of 3 major sections, one for folks that need coverage, one for folks that are already covered, and then the third is for the coverage programs, which will really be just to kind of offshoot folks to the different program sites for more detailed information. And so one of those sites, of course, is our site, the Explore Health. And so our goal is that by open enrollment, the users of our website will be able to recognize Explore Health as the marketplace. We want to make sure that folks understand the connection to OregonHealthcare.gov. We recognize that our outreach team and through marketing and various things that we've built a really solid brand with OregonHealthcare.gov. So we want to make sure that folks understand the ecosystem, and really, speaking to a lot of the feedback that you all have provided, we want to make sure that we're building that confidence in the brand leading up to open enrollment, so that when open enrollment rolls around, that folks feel confident and comfortable with enrolling within the Explore Health brand. Next slide, please. So we've broken down our brand rollout into kind of 2 categories. The first is brand awareness. And so again, this component is really to build awareness of Explore Health, making sure that our audience knows who we are leading up to open enrollment. So the goal here is to, again, introduce Explore Health to the various communities that we work with. I'll show you a little bit more on timeline on that. We've kind of broken that down a little bit as well. But again, build early recognition and trust. We don't want to, just start open enrollment and be like, hey, we're Explore Health, come give us all your information. So this spring, what we're doing is we're looking back at all of the focus group insights that we've gathered over the last few years. Some of you know that we have done a number of focus groups to gather different types of insights into plan design and messaging and marketing and all different types of things. And so we're really using all of that information to really understand how people digest information and consume information, and what sorts of messaging works. And then using that information to help build our creative assets, so that we have a really solid suite of assets leading into our campaigns, so that we can just kind of hit the ground running. And then so this summer, we're hoping to launch a statewide brand awareness campaign with hopefully some paid media, some social media, press releases, etc., to spread the word. And then in the fall, to launch more of a direct messaging campaign. We are bound to wait until our friends over on the federal side send out their direct messaging to enrollees, letting them know that this transition is happening. which should happen around early October. But once we'll work with them to really finalize the date that they're sending that notice, so that once they basically hit send, that we can start doing our direct messaging as well through the channels that we have, text messages, email, and postal mail, with the help of our new system. Next slide, please. And then, of course, open enrollment is going to be a big piece as well. And open enrollment this year will be different than in years past, because in years past we have worked alongside our federal partners on our campaign, and this year it'll be all us. So we will really be wanting to reinforce where folks will go to enroll, and make sure to, of course, drive statewide enrollments. We want to be clear, concise, and reassuring, and really the kind of message that we're going to be using is new name, same coverage, same help. So like we're still the same people, we just are under a new name. So this spring we are working on, again, planning that creative. As we develop the brand awareness campaign, we're also kind of coinciding the development of our open enrollment campaign elements, so that they go hand in hand, and they are familiar to folks once open enrollment rolls around. And then in the summer, we'll be beginning to incorporate some of that pre-OE messaging into our brand awareness campaign, reminding folks of open enrollment coming and letting folks know kind of how to prepare and things like that as part of our brand awareness. And then in the fall, of course, transitioning from brand awareness into open enrollment, to really encourage folks to take action, and really building off of our year-over-year campaign learnings, to really make sure that our campaign is successful as it has been in years past. Next slide, please. Just a second, we're stuck. Okay, there we go. So we have broken down the launch into kind of 3 groups. I think that it's important that we really intentionally roll out the brand, considering the different audiences that we work with. So this spring, we will start with rolling out internally. This looks like rolling out within OHA and ODHS staff, within different internal newsletters, and then within different partner state agencies that we work at, thinking like, Oregon Employment Department, Revenue, DCBS, things like that, so that they're starting to familiarize themselves with what Explore Health is when we start using that term. And then July, we want to start rolling out with our partners. As Jeff mentioned earlier, our training will start in July, so it only makes sense that we roll out our brand with the training. But most importantly, from my perspective, is it's really important that our partners are kind of the first to learn about the brand, because they're the ones that are, advocating for our program and really helping folks boots on the ground. So aligning our rollout with training, our partner summit, and then various outreach avenues and opportunities to community partners. And then in October, as I mentioned, we do have to wait until CMS sends that notice. So we are a little bit bound on time there, but once they send the notice, which we're hoping will be around October 3rd, then we will begin sending direct messaging to folks as well. We can, as I mentioned, begin the brand awareness campaign more broadly earlier than October, so we can start building a social media kind of following and things like that. We just can't do direct messaging until CMS sends that notice. So I have a couple of different slides for that I'm hoping that I will get feedback from you all. This is the first. I'm just wondering if anyone has any feedback on the awareness and the OE timeline, or this timeline. Are there any other dates we should consider, or any other activities that we might want to include in our roadmap?
As with Stacy in the room, looking at the timeline, it does seem like we're missing September, which it just seems like it would be nice to do some sort of outreach or engagement, even if it's more focused on the brand awareness. I just feel like we really need to hit it every which way. So it's more of a comment. I'm sure there's a reason why September's not there, but.
Absolutely. And I apologize, I should have been more specific. So the intention is that May, July, and October are kind of like the key dates, but we'll continue the activities like through June and through September. So yes, thank you for bringing that up. I promise we won't take a hiatus in September.
I was like, maybe there's a reason.
You know, back to school is important.
Right.
Thank you. Amy, this is Kathleen. You can see. Are you guys using media at all? Like news channels, getting on the news and OPV or NPR, like to advertise in such a way that.
Yeah, no, that's a great question. And thank you for mentioning. I'll show you in a couple of, or the next slide, I think, some of our different tactics that we have kind of in mind, but we do have some really solid partnerships with the different media outlets in the state. And so we'll definitely be reaching out to them to let them know both as a broad, press release, but also more directly with the contacts that we've built to see if there's any interest in interviews or anything like that. Definitely. Thank you.
Maybe I always in the room. I normally do newsletter quarterly to my clients. Is that the name Explore Health is the name? So
it is the name, but I do request that you wait.
Okay.
I will tell you for sure once we announce it to the world. But yeah, we want to hold off on officially announcing the name until we get a chance to announce it internally and then with our partners first. So, but I promise I'll give you a green light. Yeah.
Matthew here, and I think we're probably going to hit this in the next couple of slides, but to Owen's point, I'm assuming that just like we do with OE every year, as we go through this launch timeline, May, June, July, August, September, the marketplace will have resources available for the agents and community partners and assisters that we can use in things like our newsletters and that to help broadcast that information through our networks as well.
Yes. With that, I think let's just go ahead and go to the next slide. It sounds like you guys are very much interested in the tactics and tools, which excites me. So these are some of the deliverable concepts that we are envisioning. You can see everything from website graphics that are in line with our brand to creative templates. I've already started building out some of those templates, which is really exciting. But to your point, Matthew, we will have partner and also event and sponsorship toolkit. So partners will have social media messages and graphics that they can use, kind of Swiss cheese, as we like to call them, press releases or newsletter content, and other things. And then we do have a whole brand awareness creative concept project that we're working on this spring, which includes, I'm really excited, it includes assessing stock images and video to see what's available in line with our brand. As you know, we're kind of looking for that more organic feel, less stocky feeling. And then once we have all of that, the team's kind of working on that behind the scenes. We are also going to be doing a photo and video shoot to kind of capture some additional assets that we can't get on stock so that it's really featuring Oregon natively. We are going to be updating some of our publications to the Explore Health brand, not all of them, because some of them do make sense to stay within OregonHealthcare.gov. And then we're looking at making some stickers within our brand, which is really exciting. I love putting stickers on my water bottle, so I'm really excited for that. And then new partner resources and publications, consumer resources. We're looking at getting some new swag for our outreach team. As you know, our outreach team, when we table at events, we always like to have some swag for folks that come up. And then for our outreach team, things like tablecloths and banners and things to really help promote the band while they're out at events. So keeping this in mind, Dawn, if you don't mind going to the next slide, I would really love to know if you have any feedback on the audiences that we're really considering as far as needing to reach out to and build. Are there any new publications that would really be helpful as we roll out the new state-based marketplace, or to help people kind of navigate the new system, or even expand health literacy? And then are there any other assets or deliverables that we should have ready? So if you can think of anything that like partners might find beneficial to use in their outreach, anything like that, I'm all ears and I'm ready to take notes.
Yeah, in the room. So I see on the second bullet, the publication. I think you need to have a clear, simple language. Why? Why can we move from federal to state? And will this solve the problem of affordability? And primary care doctor, will I have more access to, or easier to go see the doctors? I think that would be something. In terms of some population that on the visa, they're so concerned about using this federal subsidy or state subsidy or even OHP, because that might prevent them to not to get visa. And as a matter of fact, this afternoon I'm going to have a phone call that that public charges is cash thing. You can do this, but my voice is not as strong as the lawyer who told them not to. And I just want to go to the lawyer. Just like, if this person have to rush into the ER in the hospital going to enroll that person into the OHP right away, right? So I need to have some clarification, simple language to explain for people. Do it.
Yeah. Perfect. Thank you. Yeah.
I have a suggestion. I don't know if you thought about it or if you have finances for it later in the year. Usually when you're trying to launch a new brand, some companies do like little, what's that called? Like launch parties, something like this. And maybe if you want to invite like different partners, and we get social media partners, people too, consumers, members who use marketplace, because people talk, like neighbors talk, and they will, so like if we want to spread awareness, I think it would be good to invite more members, because again, they'll talk to they'll just tell their neighbors. The other thing I was thinking, maybe it would be worth doing something like health literacy workshop for people, for members, for consumers. So when people go to it's just new. Because I mean, they might know their needs, what they need, but when they look at the new software platform, they get super confused and then they forget what they need. So it would be worth doing something like a health literacy workshop, maybe online, maybe in person, maybe like in different counties. That you guys have different educators in different counties, so it would be worth doing something like that. I know that looking recently, because libraries, you can use the library thing, like free space. And so like people like library.
Yeah. Perfect. Thank you so much. Anybody else?
Not seeing any hands virtually, Amy.
All right. Well, I'm happy to move forward because I know that I'm standing between I'm standing between lunch over here. So I really appreciate everyone's feedback, and I will definitely continue to come to the committee whenever you all want me to provide you updates. And of course, I'll let you know how the open enrollment campaign irons out as well.
Thanks very much, Amy. Thoughts on when we are returning, Chicky and crew?
Okay, no pressure in terms of determining how much time folks might need for lunch. 20 minutes, 30 minutes? 20 minutes sound good?
Yeah.
Okay, so Lindsay, Lindsay and other folks in the virtual room, it is now 11:05, so let's aim for an 11:30 start time again.
11:30. Okay. See everyone then. I'm going to put that in the chat box for folks.
Okay. Thank you very much, Lindsay. Bye. And we'll see you all in a little bit. How are you?
if the room could maybe come back. Hi, room. In Salem, y'all are still muted though. There you go.
Thank you, Lindsay. So we are wrapping up here in the room, and please note, everyone, we are now back unmuted. So please note, a lot of the different sounds will be picked up by the mic. So if you're still working on your lunch, please continue to work through your lunch, but just also be mindful of how close you are maybe to the mic.
Sounds good. Thanks, Chicky. I think, Katie, we're headed your way.
Of course she says that as I step away. Hello, everyone. Nice to see you again. That's all right, Lindsay. You couldn't know. I'm Katie Button, and I'm joined here today by David Simnett, who is a consultant who is helping us work on our strategic plan. And so David is actually going to drive this presentation, and I'm going to banner light some things. But David is largely going to lead our discussion today, and we're really looking forward to hearing your feedback.
Great. Thanks, Katie. Thanks, everyone. As Katie said, David Simnett, working on strategic planning with the marketplace. And so we're going to shift gears a little bit. I visited with you at your last meeting and gave you sort of some updates on where we're at and gathering information. Got lots of great information from you. So coming back today, to talk a little bit about sort of what we've learned and where we're at now, and then want to do some workshopping with you in terms of what the strategic plan might look like, what those different strategies might be, et cetera. So a lot of talk earlier this morning about state-based marketplace transition. And so we're really going to be focusing in this discussion on once that is sort of settled and looking at post-transition years and for that 5-year period. So we want to make sure that the plan is really informed by partner experience, it's responsive to community needs, and it's practical, achievable, and aligned across systems. So let's see, next slide. Yeah. I think I covered that. So the next slide, if we can go to that one, so it shows the process. And when we met before, we were really looking at gathering information from a variety of partners. We had completed the survey and got lots of great information, and then chatted with all of you and other partner groups too. To get sort of reactions from the survey, input, guidance on things that we should also be looking at. So we're really, we find ourselves today in sort of this middle section there on the bottom, those two boxes around getting marketplace and OHA leadership alignment draft input into the framework, and then moving into May to gather partner review of the draft framework. So we don't have the draft framework yet. We're in the process of developing that, and today's discussion is really part of that, an important part of that. So if we go to the next slide, so all of that is sort of review, I think, from things that you've heard before and that we talked about last time. And so going to the next slide, we've really sort of honed in on sort of priority areas. I want to go through each of those with you and then start to talk about different strategies that are either sort of in play today, and we'll get some updates from Katie on the where those are at. And then things that that the marketplace is looking at, and then do some brainstorming with you all about, what you think about those things, other things that the marketplace should be looking at during that sort of 5-year period. So I want to spend just a little bit of time on each of those priorities. We can go back one slide to make sure to hit on these. So priority 1 is around strengthening affordability and exploring state-level affordability tools to improve network access and really to consider focused approaches for middle-income households and small employers facing sharp premium increases. That'd be the focus of the affordability areas, given the sort of current state of the state of the marketplace and insurance in general. The next area is on enhancing consumer experience, having mobile-friendly environments, making sure that the applications are as simple as they can be, having real clear plan comparisons, and enabling people to do provider searches, drug searches, so that they can see what plans align with current providers, current prescriptions, et cetera. And then making sure that there's respectful data collection. And that really is talking about, not asking questions over and over again of folks, making sure that those carry forward, et cetera. The next area is improving integration and retention. This is in particular looking at sort of churn between OHP, the OHP Bridge Plan, and the marketplace, and doing things, for example, having really clear mid-year rules on how to, when changes are allowed, when it would make sense, looking at potentials for one account so that the people don't have to sort of jump between different accounts as they maybe move across different coverages, and sort of along the same lines, having streamlined transitions. Fourth area is around upgrading partner tools to make sure that there's robust real-time agent and assister portals, policy downloads, and customer relationship management integration, having dedicated support lines, clear escalation paths, some of the things that you all are focused on certainly in the transition and that we've heard about earlier today. And then expanding equity and access, really looking closely at language access, making sure that the plans, the marketplace, everyone involved is able to do things in culturally responsive ways. Having some focus supports for underserved and mixed status families, and really looking at continuing to build those community partnerships. So those are sort of the 5 primary areas that the marketplace will be looking at, and sort of how do we make things better? How does the marketplace make things better in this 5-year period? And looking at different strategies that would fall under each of those priority areas to move the plan forward over the course of that strategic planning period. So what we're going to do now is I want to go through each of those priority areas, share with you a little bit of information, and then hopefully have some really sort of active dialogue and conversation about how things that you want to see incorporated into each of those priority areas, things that you want to make sure get covered, et cetera, as far as covered in terms of looking at how do we enhance those priority areas. So on the next slide, this is under the strength and affordability category or priority. And as a reminder, this is looking at strategies that might be in play, reducing premiums or cost sharing, increasing covered benefits, et cetera, making things more affordable for folks who are on the marketplace plans. And so we have one area that's in progress now. I'll look to Katie to give an update on that. And then we'll move to potential for discussion and into some other questions. So, Katie, if you want to talk about the Oregon-specific AV calculator.
Sure. So as I mentioned earlier, the AV calculator has really gotten difficult to use over the years and to have plans that meet AV. And one of the things that happens is that year over year, we all have to make changes, the carriers in the state on the standard plans, we have to make changes year over year because the plans can't continue to meet AV. And so one of the parts of the AV calculator is an underlying data set that is a national data set, and states can choose to use their own data set. And so theoretically, in a state like Oregon, where we have a lot of consumer protections, we have a lot of, our plans tend to be better, offer a lot of pre-deductible coverage, getting people in to see their primary care. Theoretically, our population could be healthier. And so if our population is healthier, then we could have an AV calculator that would allow us to do things like drop deductibles, like Owen was talking about earlier. So we are currently in progress with talking to an actuarial consulting company who would look at our data and then look at our data compared to the national data to see if that might be an option for us. And then if it is, we would submit that to CMS next September. And so that would take effect in plan year 2029. So we don't have any more real information on whether we can do it, but that is something that we're looking at that could allow us. It wouldn't probably reduce premiums, but would make other cost sharing lower so that after folks pay the premium, they can access services.
Great. Any questions about that? Any thoughts around an Oregon specific?
Yeah, so I'm reading this, reducing premium or cost sharing. So you're going to reduce the cost sharing too.
Yes, the cost sharing. The AV calculator doesn't itself do anything with premiums, but it can reduce the cost sharing.
I don't know the mechanism of level funded, but I know at this year when offering the small group commercial that 1 to 50 or 50 and above, I have to go change again to level funded, and you see the premium drop. So I don't know the calculation of that. Have you thought about using that kind of calculation of level funded to make the premium lower?
So there are different rating requirements in small group and large group, and so in small group it has to be age based, and then you spread it across the group and the enrollees in the group. And large group, they can set their own kind of premiums. Individual market is all age based, and so it is whatever that age rate is, that's what you get. And so the carriers are required, and Paul could talk about this, they have to look at the risk pool, and they have to, it's a single risk pool, so whatever that risk pool can reflect, that's what the carriers have to do. So there's not a lot of options to change the actual rating structure there.
Okay.
And so Paul in the room, and just, the way level funded generally works is by pulling the healthy risk out of the regulated individual and small group markets, and that's how they achieve the cheaper premium. The cost of healthcare hasn't changed. They're just sort of bifurcating the market in a way that, is good for the people who have that option, but does create challenges for those who remain in the regulated market.
Matthew here in the room. Related to affordability, one thing that we've seen one carrier for the last couple of years has been offering plans that have a fixed copay for labs and x-rays and diagnostics. Some of those are a heavier lift than others in the actuarial process, but labs is something that I think is potentially within reach as far as establishing a fixed copay in the standard plans. We know that consumers use fixed copay services primarily and avoid deductible services primarily. And then there's an equity aspect to that too with the labs, because there are so many health conditions that are much more prevalent in communities of different ethnicities versus the Caucasian communities. So they get hit by those deductibles. Labs anywhere from $150 to $300 for a lab set running 4 to 6 times a year. Setting a fixed copay on those labs will increase consumers' access to it, their likelihood of actually doing it, which will improve health outcomes in the longer term as well. So it's something to consider on the standardized plans with a fixed copay on the labs.
Thank you. That's really good feedback. I will note that the lab copay will increase actuarial value. So when you put in the copay, then you either have to increase deductible so these are the things that we are working on. But hopefully with an Oregon specific AV calculator, you would then have room to do the lab copay without having to impact others.
That makes sense though. If we have a fixed copay and you can increase the deductible, that means on the lab copay deductible is waived, right? So it could make sense, and you're going to see if this thing happens. Let's say you put it on the silver plan, you're going to see people would shift from bronze plan to silver plan more, and then you're going to get a better AV at all, because people are going to get more active to take care of themselves. So overall, I see is a good thing.
I love it. If you see me typing, I'm typing down everything you're saying. So thank you.
Other thoughts or questions on the AV calculator?
I have a question. Elaine is here in person. You mentioned that you consider focused approaches for middle income households and small employers facing sharp premium increases. So I was wondering if you already have like a strategy plan in mind, or if you started talking about how basically you're going to do that, because I don't know how much power you have over it,
Yeah, no, that's a great question. And I think that that's there as sort of an idea about ways that you can approach affordability, not necessarily something that Oregon can do or will do, but wanted it out there for discussion today. So if you have, or other members of the committee have ideas about, how that might work, or things that should be explored around increasing affordability through those strategies, then today and future conversations is the time to talk about those.
I think I heard somebody, I don't remember if it was a hospital or somebody else. I think they were hiring an economist to see how. I think it was some health plan. I don't remember if it's in Oregon. I just read it, I think, yesterday on the news, that they were hiring an economist to see how they can, I think it's about how they can decrease either premium prices or just healthcare prices in general. So I know that a lot of different companies just hire different consultants or economists to see how they can actually maybe influence it. I know that it all depends on the policy. So like we can't really do that much. I know it's a tough topic, so it's like you won't figure it out in one day, one night. Like it's a few years process.
So I don't know. We'll definitely take that down. I don't know if you have any sort of response.
Yeah,
or
I think
feedback.
again, it's like the carriers have their own data sets, and part of it is the carriers know their specific people, and so the carriers rate for their specific people. So, but we'll definitely see if there's anything that we can glean from other systems.
I also have another question. So that you guys thinking about mobile friendly enrollment, are you talking about the app?
I'm sorry, could you speak up just a little bit?
Oh, sorry. So it says here, mobile friendly enrollment. I was thinking, are you guys thinking about to create an app or launch an app?
Yeah. So, and we'll get to that. We're going to go through all of these. And so when we get to, it'll be the next one, and we can talk a little bit about what that might look like and whether that would be helpful. So, yeah.
I'm excited. Oh, you had your hand up. Was it in response?
I did, yeah. So this is Paul in the room, and at least for me, one of the things that we as a committee can most directly support to improve affordability is all the work we've been doing and continue to do around just making people aware of their options and getting them covered. Just the bigger that pool is of people on the exchange, it will automatically be more affordable than it is today. And, I'm saying more affordable. That still doesn't mean it will be affordable, but, that's the thing where just, the work I've seen this whole time on the committee, it really does matter to sort of getting people where they need to be.
So Paul, do you have, as you think about sort of ways that that would happen, do you have things that you think should be included in the strategic plan to support that?
The biggest one is the SBM, of just being able to control the messaging, control the experience, sort of get by the hurdles that people face, going through all the means, even with brokers and partners. It is just, for me, it's the most complicated thing that most of us have to deal with, navigating healthcare. And so having a slightly easier door to get through is a big deal.
Okay.
Sorry, if I understand correctly, so you're hoping with SBM you'll increase the pool?
We'll increase the number of people receiving coverage. And when you've got more people in there, everyone gets to pay a little bit less.
You're spreading the risk.
Yeah.
And I can't see, is there anyone in the virtual room? I can't see that.
Nope, there are no hands raised right now.
Okay, great, thank you.
Just took a bite of lunch, apologies.
All right. So the next one, the item that we have there for discussion, so we're still on the first priority, is looking at employer education and on benefits of individual healthcare reimbursement arrangements, or ICRIS, is that how you?
Yeah, Chris.
Yeah. So thoughts on that? Does that make sense to have that included in the strategic plan, and what might that look like?
Yeah, I have mixed feelings about ICRIS, so I'll share that. My mixed feelings are for small employer groups that just cannot afford the rates. And when we talk about small, it's not just like under 50. I mean, you're actually seeing the types of employer groups that are gravitating towards ICRIS are really the 51 to 99 segment. And that's because for most carriers, we don't provide claims experience to them. So they don't know what their risk is. We do. We're giving them a very large increase that their claims experience would warrant, but they can't afford. So those are the groups that are driving towards ICRIS. What worries me about it from an individual market perspective is I've seen this grow on our book of business from around 300 people were enrolled on ICRIS to now we're at like 18 or 1900 within a very short period of time, which just tells you these groups are looking for creative solutions, okay? I'm worried about the risk to the individual market as I think about that. So that's my mixed feeling on it, but I believe that the education needs to go out to employers. It is an option. It is an option that to move them into the individual market in a way that's affordable, but still allows them to have something that feels like an employer plan. Not everyone is well educated on it. So some of our savvy brokers will explain it, and they're starting to learn more about it. It used to be just like this new word that would popped around, new acronym that everybody would then start flashing around, a couple years ago. But it's something that as much education that we can get out to the broker community, to the population at large, I think would be helpful. But I am a little worried about it and the risk that it might pose to the individual market over time.
Can you tell me more about what you think the risk to the individual market is?
If your claims experience, so you're looking at a higher risk, higher claims, they're getting those rates for reasons. You're now moving those high risk individuals into a market that's larger. So like we talked about, like the more people you get in there, you should be able to stabilize and absorb it. But I'm worried it's kind of like an adverse selection almost. You're taking the bad risk out of the employer group and moving it into an individual market. That's what I worry about. I think it's all about the numbers and the volume. So as long as we're growing, we should be able to absorb that on the individual market, but I'm worried about adverse selection a little bit.
So one of the things with each of these that we want to talk about is sort of how do we, what are we trying to achieve, and then how do we monitor that we are actually achieving that, and if there are sort of unintended consequences or sort of risk areas that we're creating by doing one thing, someone squeezes out another on the other side. We want to monitor those. And so as you're thinking about this specifically, what sorts of things would we want to monitor, or how would we know if it was starting to have sort of negative impacts on the individual market?
Yeah, I mean, I'd be less concerned if through education and outreach, we get populations that are like, I love this design, I want to do this, and I want to move into that market. Those are less likely going to be the ones that are forced into it because of bad claims experience and bad rates. So I think there's that. If I'm trying to think, I don't know that carriers report on our loss ratios by segment. That might give some insight into what's happening, especially as there's migration that occurs. I don't think we do that.
See, have an actuary. It's so helpful to have them right there to ask.
So there's that. But
so would that be something to look at doing in the future?
It could. I mean, yeah, it could. I don't know how open carriers want to disclose that personally, but as far as like what indicators would be, your loss ratios would tell you that. I think there's some insight to the performance within the rate filings. I mean, you can see that. You can see trend, right? Looking at trend, I think would help. But that's just like off the top of my head. I'd have to think about it more.
Great. Other thoughts? Yeah.
This is Charlie in the room. And I guess I would just caveat this with, I don't know what we can actually do to influence this, but I mean, when I hear affordability, the main thing that I think about and that we work on at OSPARC is like actual prices in healthcare. And so to the extent that there's anything that we can now do with more state control over our marketplace to actually drive down prices or direct people to lower sites service or something like that, I don't know what we can do. It seems like that is the most obvious place where we would actually be able to impact affordability and price. But again, I'm not sure to what extent we have the ability, at least in this forum, to do that. So just wanted to throw it out there.
Kathleen in the room. I think that I would look at like how much money is being made in healthcare and what's the necessity of that profit margin versus what's actually being received by the consumer, and what's the displaced balance between those two things. What models of care can we look at in other countries that are serving their citizens and non-citizens, if we shall say, to allow them access to healthcare, but we have the inability to do that here.
So would that be like looking at medical loss ratios and maybe changing those thresholds? Is that what you're suggesting, or?
I'm not sure what I'm suggesting,
Okay,
because I think it's a huge topic, but it's big money. People are making a lot of money off of people being ill. And, when we talk about improving primary care and improving disease management, I've been doing this for over 30 years, face to face with patients, and we're still doing the same thing. And we haven't made, for a while there, I really was feeling hope and promise that we were making headway with disease management and reaching our vulnerable patient population. So you don't have a bucket of people who all have chronic diseases being pushed out of markets. And now that's your most expensive pool of people that, if we all were giving a little, we could provide the care for those that need it. So it's a big pie.
Matthew Woodbridge here in the room. As far as employer education on the benefits of ICHRAs, I think, in my experience at least, the employers that are looking at ICHRAs are consulting with an agent, they're working with a broker, they're not doing it on their own because they don't understand it. So anything we can do to skill up the agent community is going to help support that. That's probably the main resource that they're relying on when they're looking at ICHRA versus a fully funded plan. And so the more educated and competent our agent community is in that area, the more effective those decisions are going to be made at the employer level.
Yeah, from a broker standpoint, in the room, Stacy is right. People who are looking for ICHRA are more 51. And among of this year, I'm doing this, just only one came to me. If there are a small group and have one employee, I always look into the benefit that employee going to get, and pretty much small group offer slightly greater benefit. And for the similar amount of money, I would shift it to that small group. Easier for them, no headache, than have to go to healthcare.gov, clean, and everyone is happy.
All right, so some suggested strategies on ways to do this. A little bit of caution on making sure that it doesn't.
I think you keep it as an option.
Yeah. Any other thoughts on this one? All right. So I want to talk for a minute here, and you'll see this through each of these priorities. It's sort of like, what does success look like in this particular area? So if we're trying to strengthen affordability, what sorts of metrics or measurements would make sense to take a look at to see if that's actually happening?
The size of the pool. So there should be clear targets, and this is what is also concerning to me. Sorry, it's Stacy in the room. Is that the number of insureds like goes down every year for some reason. So we're seeing this market erode over time. It would be nice to know, like we should have clear goals for, I'll call it retention, right, of the market. So you know that I enrolled yesterday or last year and I'm enrolling this year. So that's retention of me. There should be clear retention goals. Are you trying to retain 90% of the population, 85%? And then the growth goals. And by getting education and trying to figure out why people are leaving, you know, is it affordability? Is it network? Is it lack of choice or access? I mean, I think that would allow us to actually create or refine strategies even further. And I don't know if that effort really happens when someone exits the market.
Get insured friends. Do we ask people when they don't renew or when they choose to terminate, do we ask them why they're leaving?
We do.
So we can report out on that annually or something.
And that's another configurable question. Yeah. Everybody's favorite answer, but we can work with you on refining language on that too.
We also ask what they're going to, like not just why they're leaving, but what are they replacing it with?
It's a good question. So my recollection is the drop down includes, you know, I got employer-sponsored coverage. I'm aging into Medicare. You know, I'm moving into Medicare. So it's sort of focused on that. And of course, you know, it's unaffordable is also in that category.
Sort of along those same lines, is there state data? I mean, so looking at sort of number of insured within the state, do we know as people move from one market to the other where they are going, or you know, if they're leaving one, they're popping up somewhere else?
So we'll have more information when we know, when we have the SVM, we'll know if we've referred folks over to Medicaid or BHP. And then we also, the OHA launches the Oregon Health Insurance Service, building, I believe, next week or the week after. And that asks folks a lot of questions too about, like, have you changed coverage? Where did you go? And so we try to get to it kind of from that way, because that is part of the problem, is that folks leave one type of coverage, but we don't necessarily know, did they leave the market entirely? Did they move to another state? Did they just get a job and they have new coverage? So those are things that we're hoping to get more information on, but we don't have like a statewide, you know, health insurance system. We don't check with Moda. Hey, did you get John Smith? He came off Marketplace. He said he's going to employer. You know, it's hard to cross-reference that.
The new system, correct me if I'm wrong, but remembering from UI review, the new system, I believe also there's a question if you end your coverage, like why are you ending your coverage? So we'll be able to capture some information there too.
Okay.
It does seem like carriers do provide reporting on some basis about each of us, our block, right? How big is your small group, your individual? And if you could get down to association plans, do you know what I mean? Mm-hmm. Theoretically, what we should be seeing is a little bit of this migration, right? Where groups are they're moving from the employer group into the individual market, out of individual into something else, where you can kind of start to see where things are shifting. But I don't know if that information is really housed somewhere at the state and that can be shared and disseminated in a way where you could make some.
Do you know if large group reports on it? I think that's one of the problems.
No, I think that is the issue. Is it something about self-funding
the
or
self-funding
large?
groups, since they're not required to do things? I think that's where lots of it breaks down, is that we have information about a lot of people, and then this large group section is just kind of out there.
Couldn't you do something about it? Because I feel like, not you personally,
yes,
but I will do it. Yeah, not you. But I mean, like, as a state, couldn't we choose to? Because I feel like each state has different requirements from the carrier, and some are greater, some are less and more lax. But it seems like.
So I believe our neighbors to the north have asked the self-funded plans if they would do things, and that they have agreed to. So we are looking into that. So it'd be more like voluntary, like because we can't do things that go against ERISA, like we're just federally prohibited. Totally. Right. But we could ask you, and you could say yes. And so that's one of the things that we've been talking about.
Another potential data source looking at affordability, you know, an indicator of affordability in my mind is utilization. if people may have coverage, but that having it may be all they can afford. They may not be able to afford to use it, and that usability is part of that affordability in my mind. So I don't know what kind of data we can get as far as, and it would likely have to come from the carrier because it's claim-based utilization. I don't know what percentage of enrollees in a market segment are doing their annual checkups, doing their preventive care, utilizing urgent care visits, labs, x-rays. So just, aggregated data, obviously individualized, but knowing those percentages and looking at growth in those percentages. If we see an increase in those utilization numbers, we know that people are using their health insurance more. That indicates that we're making progress in affordability because people are not holding off and delaying that care.
And is that something that would be accessible to OHA through like HIMAC data?
Theoretically, we struggle a bit with APAC, both because there are weird restrictions on who can access APAC even within the agency, and then also the way that, again, the different plans report. But I know that the carriers do report to APAC by individual insurance plans, so we could theoretically pull some reports on that. So I like that idea. I've written it down.
Thank you.
Kathleen in the room. I would also, because that's like downstream information, but in upstream thinking, which goes back to Amy's group, is having very simple instructions on how to access care. Like what is appropriate access of care? Because you've got that chronic disease population that will wait until they're in acute phase. So they're often using emergency rooms or acute care or urgent care versus partnering with primary care, doing virtual health visits. So.
Yeah, no, that makes good sense. It kind of goes back to what Charlie was talking about in terms of, how do we reduce the costs of services and that prevention and management is an important way. Someone on the
Lindsay? Yeah, thanks. I was just going to chime in to add to some of what Stacy shared. I agree. Size of the pool and stability of the pool is really important. I think measuring affordability from multiple stakeholder perspectives is important because, not to call anything out, but a number of the things folks have been discussing will not improve affordability in a 1-year rating cycle. They might in 10, they might in 5, but in 1 year, those rates are going up. So balancing short and long term to retain stability of the pool and measuring affordability from a carrier perspective and a participant and member perspective seems pretty important. Thanks.
Thank you. All right, we're going to move to the next priority here shortly. Is there anything that stands out to you in terms of strategies that the marketplace should be considering that we haven't talked about already around affordability?
Again.
We love it, keep going.
Yes.
I'm writing it all down.
Yes. We really need to tell them to use the plan, just like Matthew said. This is the first year. We have to forecast that you're going to have a small group of people. There will be a certain group of people who will buy health insurance even though it's hurt them. But there are certain group that buying because of agent, like us doing the work and they trust us. But they, even though on the bronze plan, even though the $5 for 3 visits, they're so afraid to go to preventive care. They're afraid that if they find something, they have to go pay deductible. So that has to be help, create some plan to help them to use the plan. And then when they use the plan, oh my, just like insulin, if you can control them for $35 per month, there is something you can do to encourage them to utilize the plan. When they utilize the plan, they feel like they can see the doctor, even though 3 months is okay, but they can still see the doctor and everything's good. They will go tell other people you should have health insurance. Everyone wants to have health insurance, but they just cannot do it. I see people come to me, I pay so-and-so $800 a month, but I don't use it. Right? Yeah. And those groups are going to continue to be for these Explore Health.
Okay, yeah, no, that makes good sense. And it's like really looking at sort of the value
Yeah.
as part of this sort of
Yes.
affordability.
You have to encourage preventive,
Yeah.
encourage the preventive care as much as we can.
Okay.
Do our carriers have any information like that? Like, do you have like little one pagers or anything that you like
Oh,
send
yeah.
out to people?
Oh, yeah.
Because we could put that on our website.
Yeah, we do. I think where it needs help is putting it in a way that makes sense regardless of your language. I think sometimes as carriers, we talk very much our own language, right? Which is nobody's, just to be fair, but it needs to be more like scenario based versus like, here's your deductible, go get your preventive care, deductible's waived. Instead, it's like, I just want to check my blood pressure. Like I want to make sure I'm okay, right? Do more scenarios that make sense. Or my child fell down and I'm not sure if they broke their arm, right? I mean, and then there's tips that each carrier, like if we're out, we talk about like there's a virtual option that costs you nothing. Go do that first, right? Because then if it's nothing, sometimes we're like worried and you want, you're like, it's going to cost so much money, but it's like, I need to know. So there's little tips I think that each carrier talks about when we're out in the market that we could pass along to help the consumer that you might not even be thinking about.
Can you do that? Can you pass it along?
Yeah, no, for sure. I mean, I can like write the notes. Like
Matthew and I talked. Matthew had a really great idea.
This would go perfect.
Yeah.
What we were
Go
talking
ahead. I don't want to steal your thunder. Go ahead.
So I get distracted in the piece of our meeting where it would have been applied, but I came up to Amy afterwards and followed up with, Medicare, when someone enrolls in Medicare, they send out a little newsprint 3rd-page booklet, which is Welcome to Medicare. And it defines terms in clear language. It provides what steps, now that you've got your Medicare coverage, what else do you need to know? How do you use it? How does it work? What are the tips? How to get help? Something like that doesn't come with individual health insurance. And so we were talking about adding something like that. Now that we have the state-based platform, our ability to insert something like that into your eligibility packet when it shows up as its little standalone, that kind of information from the carriers, those things that are universal across the board, like the virtual care and these things that help people utilize, would be perfect for welcome to health insurance. And we also talked about potentially, someone new versus someone renewing a different booklet to reiterate some of that information. So that kind of a communication would help across the board too.
Yeah, I mean, I know I've talked to Katie before, but I would love to get some kind of communications work group with the carriers together to talk about some of these things and figure out like, what are the tips? What are the tools you all have? How can we work together?
I don't know if it's going to work for individual market or not, but in small group or large group, if you enroll people, new or renew, we will always say, go to wellness, you get $50 credit or $100 credit. But if the state can even offer $10 gift card, I guarantee people will do it. Yeah.
This is Kathleen in the room. Going back to Explore Health and just the holistic kind of organ feel that you're going for, you could even do, and all the visuals that you guys have already put together is such a great reflection of the state. You could even do like climb the mountain, and it starts with establish a PCP. Go to your first switchback is you saw your
pretty good.
You had your labs, you've addressed your A1C and blood pressure. Like you could climb the mountain and oh my gosh, you're at optimal health.
Yeah.
Actually, that's a fringe benefit from one of the Medicare carriers that do that. That people have to log in and report it, and then they get $5 more, and they're excited about $5 or $10 a month.
Right. So let's go ahead and move to priority 2. We've hit on some of this, so it's a good segue, I think. But it's really looking at enhancing the consumer experience. This is things like improved plan display, better assistance as they're making application renewals, those types of things. And so, Katie, do you want to talk about the work that's already in progress that would support this priority?
Sure. So Amy and I and a few others on our team have spent a long time going through the language that's on the Get Insured site to make sure we're using terms that we use in Oregon. Like we call them insurance companies. We don't use issuer or insurer, right? And then Amy and I have long wanted to
do help improve health insurance literacy by providing more language that people get, right? Like deductible is a very hard term. It's commonly defined as the amount you pay before your coverage before your insurance carrier begins to cover anything. It's not true on the vast majority of our plans. You could be on that standard bronze plan and see the doctor 100 times and never pay anything towards deductible. So we've worked really hard to try to improve the language in there so that consumers can understand more what they're getting. And then we are, Jeff talked earlier about our training that we're going to do for our agents and community partners so that they'll really know how to use the tool. And then we will have, Elena was bringing up the mobile friendly stuff. And so that one of the things that the Get Insured product can offer is a better experience on mobile, because we all know most of us use phones. I don't even have a personal laptop anymore. So folks being able to access information on whatever form of media is comfortable for them will be really helpful.
Any thoughts or questions on that before we move to sort of, other things that might fall under this priority to take a look at?
Be louder.
Okay, all right. Okay, so let's look at the items there that are listed as for discussion. So the first one is to continue to develop and deliver training to specialized assisters and agents regarding HR1 requirements and other provisions sort of 2028 onwards. So this is just sort of, as new changes go into effect or come into being, making sure that folks are well educated on that. And then looking at additional shopping tools that maybe create curated lists of plans for selection, so it's not the whole universe, but things that might be most applicable to a specific person. And so with those, any thoughts or reactions? I want to know specifically around the shopping tools, what tools that you all think might be helpful there. But anything else about any of that stuff?
Matthew here in the room. Speaking to the tools, I think that the tools that we have been using and are looking at using going forward with the state-based platform, in my experience, have been really good. They have been a stark and improved contrast to what's available on healthcare.gov directly, and much more in line with user functionality and clear information, usable information in a digestible format, and presenting comparisons that truly inform the consumer. So that has been really nice to see, and I'm glad that we're planning to move forward with those along with some additional enhancements, it sounds like.
So in the room, my understanding they can use a shopping tool to OregonHealthcare.gov, and then there will be a link to apply to Explore Health. Is that correct?
So we'll have an anonymous browse function where folks don't have to log in. They can just go look at plans. They can put in all the scenarios, and then they can go and create an application, or they'll be able to just start right off and create an application and shop. So right now, where we have our marketplace window shopping tool that's on our website, and then folks go to healthcare.gov, they won't have to do that. They'll go to the Get Insured tool, and if they like it, then they can create an account, and the Get Insured tool can say, you are already looking at this plan. We already know your birth date because you put it in, and they'll kind of pre-populate some stuff. So it'll be a much more smooth experience.
My suggestions on OregonHealthcare.gov that if people put something in, they should be able to save it. They don't have to re-input all the time. Yeah. So that would help them a lot.
Check. What's happening?
Okay. Yeah. I have a question regarding that application process. If they start it and then back out of it, and you had said that they can shop anonymously, does that actually now get distributed to people that are going to start calling those people and sending spam to them?
No.
Okay.
We don't ask for the anonymous browse. We don't ask for an email or anything like that. And then when the account is created, that is protected information. We don't give it to anybody else.
Okay, so I think this is my hopes and dreams, right? At some point, like if, for example, like we're all, I'm sure at this point in time, we're all savvy online shoppers. So for example, somebody starts an application and maybe it's an abandoned cart somewhere somehow. If anyone's going to reach out to you, it's going to be the marketplace team. It's going to be the system saying, hey, do you need more time? do you need help? Versus us farming out the information to external parties, it's really going to come from us and from the system.
Because I think the opposite erodes trust.
Yes. Yes, we are very, very particular, rightfully so, and because it's just our culture, we are very protective of our consumers' information.
But we should be tracking where people are abandoning, I guess, right, to figure out if it's, is there something wrong? Is it, I mean, I don't know. I just think that will be very important to understand.
Jason in the room, so that sort of baked into our user experience team is exactly that. So, we're able to analyze and see exactly where folks are, abandoning, where they're dropping off, where they're hesitating and even spending more time on a page or a set of questions. And then that helps inform changes to the system,
everything, right?
Design and do we need to reword the question?
Right.
And also, to Chickie's point, creates those opportunities for follow-up. Did they drop off? Did they complete RIDP and not move forward? Did they start their application and not finish it? And the message to each of those populations is different. And as a state-based marketplace, you can send that targeted messaging based on sort of where the population ends their journey.
I can already promise you in open enrollment, my first few hours every day will be watching.
Mm-hmm.
What's going on? Like, where's Chickie? She is watching watching my dashboard. We're very excited to gain access into kind of our enrollee database, their behavior, how we can help them in real time.
Like access control room.
Yeah. That's great. Indeed, it's going to be a flight control room. That's what we're doing, team, today.
So I think we're starting to hit on sort of the next question here in terms of like what does measurement look like? How do we sort of monitor whether we're accomplishing this particular priority? And so I'm hearing looking at abandonment rates and looking where at that sort of stickiness in terms of where people are at in the platform and taking some time and looking for opportunities to smooth that up or have some follow or whatever that might look like. Are there other ways that you can think of in terms of how do we monitor success in this particular strategy area, with data or whatever?
Charlie, are we doing any sort of focus groups where we just get groups of people to use the tool and then either rate their experience or highlight the things that are challenging or what's missing?
Focus groups are not currently planned, but we do have user acceptance testing and then I think there's some additional testing.
I think we call it the usability work group, which is going to be starting in June. Yeah.
And who's done that?
I think that's up for discussion.
We don't have that list set, but the idea is that that's separate from just state people doing acceptance testing, that it is external folks, partners, and users as we can get them. But we know it can't be like everyone, like in Oregon, so we have to kind of contain it and make sure we maximize the efficiency of what that group is able to look at. And but I think on an ongoing basis too, just kind of what you're bringing up, it might be worth seeing if there is a way to, maybe not for this year, but including our sort of marketing team to look at actual focus groups to say, here's what it looks like, here's what it's doing, get that kind of feedback in that way, as opposed to just a functionality test or and part of that is just us getting a new thing and getting used to the new thing. So really what we're focused on more right now is, out of the box on November 1st, does everything work the way people expect it to? And then as we move forward, it'll be, how do we make this even better than what we have when we introduced it? So short-term plans, contained and kind of smaller. And then as we're able, if it's possible to fit in something like more definite focus groups in there, that's stuff like that's never off the table.
Maybe they're trying to do that.
I love focus groups, so I'm down.
Yes, I looked immediately to Amy because we have done them in the past and they're incredibly helpful. And I would just also add that anytime I hear any anecdotal information, I write it down and note it so that we can try to make changes.
So, and just a quick question, is there an experience survey at the end of the enrollment? Would that be another indicator that would be available or could be available?
So currently there's not. There's a, so at two different touch points in the contact center and then via chat, via online chat, there's a survey opportunity. But on the platform itself, there's currently not a survey. That is something that we've talked about internally as a product enhancement. And agree with you that that's a meaningful data point, either at the end of the consumer's experience when they when their session ends, or even in follow up, right? Even in we saw you visited, we wanted to follow up and see how your experience was. I got one from American Airlines when I flew out here. How was your flight? That type of a follow up post experience survey, I think would be valuable.
Excuse me, Matthew here in the room. 3 data points that I think, as far as group plan, the consumer experience, on time on page for each section of data entry. So as they're moving through the application, how much time are people having to spend getting the information for each section completed? Are we seeing a particular section that is really challenging and takes a lot of time, as an outlier? Overall time to completion, obviously, and then number of visits to complete. So how many times is a consumer logging into the system to get their application completed? Is it taking them 10 logins to get this thing done? Is it just one? Great, and obviously the more we see those shrink, then the better we're doing as far as the consumer experience and the information being clear and navigable.
As we're looking to do surveys, it sounds like it's the future. Even if it's a simple thumbs up, thumbs down, you don't have to completely redo the world. I think that would be helpful. And then if you have the ability to tailor it to just maybe, if the election is to do so, would you like to be part of a focus group, or can we contact you to learn more? Because I think that's really the only way we're going to get really good feedback without spamming people and eroding trust. As you implied, it just might be a nice way to kind of connect and invite in.
This is Kathleen in the room. Does it tell people up front in the application process how long the process will take?
It's a really interesting question. So the system does not, but what we have one state that has done that. So the application is divided into about five different discrete sections, and at the start of each section in one state, they've elected to say, this section will take roughly, approximately 10 to 15 minutes on average, and sort of set the stage. So as the person prepares and goes through, they can make the decision, oh, I want to save and come back because I've got something else to do. And that's something that can be accommodated just through a simple, content change on the page.
Or even up front, before you get into it, this on average takes 35 minutes, and here's the type of documentation you might need before you get into it and have to pause and stop and get back.
And we do provide that, sort of give a preview as they're going through of what to expect, types of documentation, the types of questions you're going to be asked.
And time.
Yeah, we don't have time yet.
We don't have time yet, but we
could add it.
Before you start, collect the following data.
And be prepared, it might take you
and
30 minutes.
Once you have these things in place, proceed forward and expect this to take 30, 40 minutes.
I'm repeating all this. People say, I think when they enter, you need to have a checklist, how long this is going to 10, 15 minutes. And simple, you need name, date of birth, zip code. And the most important part is income. And if you have just a 5 or 7 bullet, I'm a bullet girl. And that would be easy for them, for people who don't speak English, to copy and paste and, translate. I translate it. And because what scares them is the income. Yeah. Right now, especially with the enroll anyone in marketplace this year, income is just you have to tell me the truth. You cannot lie or, forfeit anything. So that's the main thing. You can explain, if your income, if you in the restaurant, if the tax tips is still not included, you can exclude it or something like that. In another, kind of bright columns, explain to them what is supposed to be included income.
Great. All right, I'm going to move us to the next priority area. So looking at priority 3, improving integration and retention. This is looking at ways to reduce churn between Medicaid and the marketplace, streamline those transitions when people are moving from one place to the other, and having clearer mid-year rules about when and how people can move mid-year. So Katie, do you want to talk about the things that are in progress?
Sure. So one of the things that is super cool about having an SBM is that it actually knows when people are basic health program or OHP bridge eligible, and not just, we expanded Medicaid a lot. So we're really excited. We've put in a bunch of different income categories and household categories so that when folks come to us, we can correctly off-ramp them to one. So Healthier Oregon program, BHP, Medicaid, CHIP, pregnant Medicaid, all of those things our system will be able to do so that it can off-ramp folks faster. And our hope is that, sorry, I'm very excited about it. And our hope is that we will be able to give the one system information that is more correct so they can process applications quicker. And hopefully we'll have more of those instantaneous kind of processing moments. And so then folks won't have to submit anything additional to one. And then they'll get their letter that says, hi, welcome to the Oregon Health Plan.
Is the goal. We're not saying that's exactly how that's going. That's the North Star that we're headed towards. I just don't want to set the wrong expectation.
Yes, the one system has to do a lot of adjustments, and so, but we will at least, like I said, be able to off-ramp folks correctly.
Okay, so can people deny OHP?
No. If you are eligible for the Oregon Health Plan or OHP Bridge, you need to take that coverage. Okay. And then we do know that we run into folks though who have duplicate coverage who are unaware of that. So we've been working with the OHP team, and our notices will also be able to say, hey, we referred your application to one. When you get your Medicaid determination, you need to come back and terminate your coverage, and we'll know who we sent to one. So if 4 or 5 months have gone by and we still see them in a QHP, we can send a second notice and say, hey, we sent you to Medicaid. Did your Medicaid coverage start? If it did, please come back and terminate your QHP.
It already is programmed to say that, just so you know.
So come back. Sorry, can we come back to get into? Can I track these clients on my BOB then if they were eligible for OHP? Can I track the status of OHP?
So you'll see the status, Jason, in the room. When we make that assessment and we send them over to the one system, you'll see that they've been made or assessed to be potentially eligible for Medicaid. And then when we get a response back from the one system, you'll see that they are, if they're accepted, that they were determined to be Medicaid eligible. So you'll get that, you'll have that update, but in that sort of intermediate period, right, that duration that it takes for that application to be processed, we don't get any detail.
So we won't, for example, be able to display, this is with one system, it's going to take X number of days for processing. Like that type of granular information will not be available.
Matthew here in the room. Following on to that, with this initial transition to the state-based marketplace, I expect that we have a population of people who are currently on marketplace plans under healthcare.gov that are bridge eligible, basic health plan eligible. Do we have an idea of what the size of that population is? And I'm assuming we are prepared for that transfer and expecting one to be able to handle that workload all at once, because capacity could be an issue there.
So we don't know for sure the size of that population. We can guess based on how many folks are in the marketplace under that income range. Yeah. But yes, one knows that we are going to send all those folks over. Okay. And so I'll just note, especially for our carrier friends, that when folks are determined eligible in the SBM for OHP or OHP Bridge, they'll still get re-enrolled for 27 in marketplace coverage with tax credits and CSR if applicable until they come back and tell us that their Medicaid coverage has, or their OHP bridge has started, because there could be a gap. So if there is a large number of applications and it's taking a while, folks could be hanging out in the marketplace for a few months, and that's totally acceptable.
Thank you.
All right, so looking at some potential items here on ways to improve integration and retention in that for discussion box there. Looking at better coordination for OHP enrollees who are in continuous enrollment who wish to move to the SBM. And then looking at the language in the notices to make sure that it's clearly communicating what it needs to be communicating, and that that's presented in an understandable fashion. So thoughts on those? Do those make sense? Things that should be included in the development of those? Any feedback on those strategies?
Yeah, Matthew here is something to be included. I think this was discussed in a previous meeting, but more notices as things are coming to an end with coverage through Oregon Health Plan and the Bridge program. Is more notices. Currently it's one notice and that's it. So they get missed a lot. So more notices is definitely good.
And like staggered over time, or what is that?
Yeah, that's the challenge. Is it's one notice, it gets lost in the shuffle. The consumer doesn't open it, doesn't pay attention to it. Does another notice just also get lost in the shuffle? What other methods could we use to notify them? Yeah. If we have a call center making outbound calls, people can have an email address on file for because that is in the system. Shooting out an email, something other than just one single notice. You have multiple attempts to shepherd them on. Whether that's if someone's moving up and they're potentially marketplace eligible, the marketplace center receiving that information and making active outbound contact. Some way to ease that transition and shepherd that handoff.
To go on that, this is Kathleen in the room. Could they because I have not seen this yet, will people have an account on the platform where they will see their plan, right? Could there be like a countdown to re-enrollment? That's just kind of like a hot button that shows them you have X amount of time left, and then to go hand in hand with those notices.
So Jason in the room again, during open enrollment, there is automatically a countdown of the days remaining in open enrollment. In addition, if the consumer has an open data matching inconsistency, we let them know how long they've got in a sort of a highlighted banner at the top of their dashboard to try to draw attention to that action item and create that sense of urgency. But which is also done through targeted outreach, whether it's paper notices or emails or text messages, outbound calls. Yeah.
Are you able to do push notifications through that application? I mean, is that something we will be doing?
At Go Live, no. We are working on a consumer mobile application that would allow us to do just like with any other application in the App Store, would enable us to send push notifications.
And Shobha in the room. I would say I would love to see, in this integration piece between platforms, I see a lot of folks that are confused, scared, and kind of lost, right, in between. I would love to see some sort of integration to the Find Help tool of being offered at that point in time for folks to be able to reach out to an agent, community partner, to check on status, to help kind of educate, to walk folks through in between, because I see a lot of folks that, this happens to. Their applications go to OHP and they get stuck kind of in next land for quite a while. And that's what, partners and those folks could offer. I just think that's a really good timing and a good place to be able to offer that help tool, which we already have
I like it. It's like a coverage
in a different
tool.
place.
Yeah.
So we already have that, that built. I just think that is a specific timing where that would be really relevant to be able to integrate.
So I think we are just about out of time. So I want to take a quick look at the other priority areas, and then sort of talk in general about metrics or measures that if we haven't talked about them already, that you think would be important or helpful monitoring points. So the next one here is upgrading partner tools. And I don't know, Katie, if you want to talk real quickly about the in-progress stuff.
We'll have an agent portal. It'll be awesome and exciting, and we'll have a special call center line for folks. And then we'll actually be able to get in. I'll be like, yes, Matt, I see where this person is stuck. Let's fix it. I will call Modet and we'll get it fixed. So that'll be great.
So, and I think the Open folks have heard, the feedback on this part. Are there other things besides EDE that you think would be worth taking a look at in terms of partner tools?
Can I just add really quick that there will be an agent and an assister portal?
Yes.
Yeah, there'll be two separate portals, but I just it's important to mention that.
I didn't know that, so thank you for
also-
clarifying.
Yeah.
Today I learned.
Because that's, healthcare.gov assisters can't access it all, but they can.
Something that would be nice is, and I'm going to say this, but this is probably not the way it would work, but like a performance guarantee. So not a performance guarantee, but like what should a broker expect during open enrollment? A response within 2 days to this line? Like, what are your performance standards that you're trying to achieve to that they should expect? And that's the part where sometimes it feels like things just kind of get lost into this. And the reality is they're very complicated issues usually that take time. But we should be at least communicating back that who's working on it, what's our estimated time to get back, because they're just trying to help the consumer. And that consumer's kind of being left in the middle sometimes.
And then those could be part of our metrics, right?
Exactly,
Like
but how
do
many
we
times
meet
did you
those
actually,
turnaround
yes,
times?
that
Yeah,
would
great.
be ideal. And I think you'd have to get support from the carriers to agree to get back to you as well. I mean, it's not just you, but I think we could all work on, it's a similar goal because we're trying to do the same thing.
So, Amanda, we were looking at the second bullet on call center for agent. When that call going to be alive, and who are we talking to? Are we talking about outsourced call centers outside of the U.S. or someone in the U.S. locally in Oregon?
I'm happy to chime in there. So it's a contact center that we operate, all US based, and we prioritize hiring within the state. So that's our focus. We'd love to have 100% of the call takers be located in Oregon. Our experience has been we're not always able to get to that level, but we do want to prioritize that. And these are folks who go through. We were just talking this morning with our call center folks. We've already started our recruiting process, and we'll start the hiring process, and then we'll begin the training process. And these are regimented established activities that we've got. And with respect to the sort of the enrollment professional line for brokers and assisters, those are a group of specially trained contact center representatives who, either many of them have been licensed or are licensed agents, right? They know the business, and they've, got a higher level, a special level of knowledge and expertise to be able to support that community.
So just to add on to that, so this Consumer Assistance Center may be outside of Oregon, but will be holding Oregon times. So it'll be Pacific times. And then I would also want to really highlight that this Consumer Assistance Center will have Oregon-specific information. So like right now, the experience with calling healthcare.gov is like, hey, I'm on OHP Bridge. What's that? It's like, okay, either they don't know the information and then they refer it back to us. That will all be different. And then lastly, anything for consumer case escalation, Tier 2 and Tier 3 will be coming to us. So we have program staff will be in charge of that. So you will always have some form of Oregon touch.
And then the last priority area here is around equity and access. You want to just take quickly on the
yes,
things in
so
progress?
we talked about it actually earlier that we'll have access to a lot more languages, people who speak those languages as their first language to help folks. And then we will again have our own data, so then we can say, hey, oh, we know that you work with this population, excuse me, and we're seeing that only 10% of them have an agent. You know, maybe you'd like to connect with them. So that'll be really rewarding. Please go ahead while I have some water.
Yes. So looking at additional opportunities potentially, potentially looking at including traditional tribal health practices in coverage for those plans for American Indians and Alaska Natives, and then looking at the meaningful language access metric that's currently in place for CCOs under the Oregon Health Plan, and potentially adopting that within the marketplace. So those are a couple of ideas. I don't know if there's thoughts or on either of those or additional things that you think would be meaningful in expanding equity and access.
I have a question. I just realized that you said that you have access to more languages. And I think maybe Amy mentioned that you have like Google Translate or anything like that. And then I remembered how, I don't remember, it was a state application for something. It wasn't for Medicaid, it was something like that. And it was in Russian. And I remember I was reading that and it would just like, didn't make sense at all. Like I'm pretty sure every other language speaker would agree with me. Just like whenever you read an application in their language, it makes no sense because either we don't talk like that, right, or we wouldn't use terms like that. And then here's where cultural linguistics comes in. Here's where health literacy comes in. So you need an assistance for that. So how I guess my question is, how do you translate? And is it only, or like using assistance in translating that, or is it only you just rely on Google Translate?
I will let Jason and Ginger talk about the system. Upon launch, we will have our notices will only come in a couple of different languages, just for quality assurance purposes. But as we continue forward, we plan on rolling out more languages, and we will definitely have we'll have a very good quality assurance process for those. But I'll let you all talk about the system.
Yeah, absolutely. So at launch, the system will support English and Spanish, and the Spanish language is all translated. It will have all gone through the state's translation service, so we can be confident in the quality for sort of native Spanish language speakers. In terms of the quality there. As a support, a partial support, we'll also integrate with Google Translate, understanding all of the limitations that exist there. The sense, I think, generally is it's better than not having anything, but would love to hear others' thoughts on that as well. And then as we move forward, sort of to Amy's point, looking at what other priority languages we would want to bring in to the platform to translate, the entirety of the content.
Yeah, I know stuff. I mean, you will be able to like 200 languages is.
So I think just to add on to that, as a general practice, we in the Oregon Health Insurance Marketplace, we try not to just translate, we transcreate. Mm-hmm. We are very sensitive to the nuances of every single language. So for example, anything in Tagalog, it goes through translation services, it goes through QA, and then it comes to me. Because I speak Tagalog and completely, and I'm like, oh no, this completely does not make sense. Yeah. So same thing with Spanish, we have like 5 Spanish speakers on our team. So it goes through several layers of QA and then it comes to our team. So we are very particular, please know that. We recognize limitations of Google Translate, and if we could get Google Translate to change certain things, we would try. But at this point in time, those are kind of that's our standard operating procedure with the marketplace. And again, we will always look for ways to refine and always looking for feedback.
No, thanks. I just realized that
I haven't really asked how it works.
Oh, no worries.
We have been, the Oregon Health Insurance Marketplace team, we have been around since 2015, and even before that, we have a lot of alumni. So we come with a lot of experience being on healthcare.gov. We have a strong starting five. We have an extremely deep bench. So I do think that that's one of the benefits of us transitioning with coming with so much experience, that we have established networks, established processes, and that's one of the things that we are very, very particular. Like, we spend months and months and a lot of budget, and much to my team's dismay, they know how strict I am about certain things. So please know that is definitely equity, language access, digital accessibility, all the things that are important to you all. We hear you, and definitely it's a top priority.
And not to belabor the point, but just we also have we have partners that are very diverse and speak multiple languages, and a lot of times we'll pull them into to say, hey, do you have capacity to review this and provide us feedback too. So we always looking at ways to Chicky's point, to improve and get our quality.
I'm sure the answer to this is yes, but are they also translators that are medical terminology certified? Because I know.
Yes, some of our services can be, yes.
Excellent.
Depending on the notice. Especially, some notices are just more consumer friendly without medical terms, so those are not as strict, but then anything that requires medical terminology, we do try to find opportunities for that.
Matthew, you're in the room. This is kind of dovetails into equity and consumer engagement and overall confidence, and kind of following on what Chicky talked about there with the deep bench that we have in the marketplace team and the language and cultural experiences. Something that may be beneficial to consider is kind of a Meet the Marketplace series, through social media or somewhere out there. Not to put anybody on the spot.
So follow our social media. Yeah. We have marketplace faces, and I think marketplace faces. So we have a lot of people who are very much in the field, and they're extroverts, and we also have our share of introverts. Yep. So like me, you haven't seen me in social media because I am technically an introvert. But yes, yes. So thank you. I'm
trying to get her out there.
Yeah, tying that to the Explore Health launch and branding, and those faces and experiences are what make Oregonians, and that's what our consumers are looking for. That's what. And this team is, we have such an amazing group with such amazing backgrounds and experiences, and those lived lives are what is going to make Explore Health the success that it's going to be. So highlighting that as part of our launch and branding, I think, is a critical piece for engaging consumers. Showing that expanded equity is one of our core values goes a long way in expanding that equity, because people share that with their communities. So it increases our reach, and you're looking at exponential reach versus what we can do at the individual level. So.
Okay, fine. October, maybe. No.
Let's
let's launch first, then.
So one more comment for you on all of those priorities. They're all very important. So by giving this one comment, I'm not trying to make this one way to the top. But on priority 3, going back to, I think there should be clear metrics on what the goal is. I think it should be 100%. We should not have anybody slip through the cracks, because in my mind, this is one of the most important ones. This is our most vulnerable population as Oregonians, and this is the one that I think we should just all agree, we should have a zero tolerance for them to drop through. So it'd be nice to state that, and then to measure it, and to do everything we can, whether that's personal outreach or these other ones that we talked through. So they're all important, but number 3 really weighs on me as I look at your strategic plan.
Yeah, go ahead.
Can I go back on priority number 4? I just have a dream. I believe it's an impossible dream. Can I have a URL to, personal, so I can send it out to the whole world. And then if I cannot help, I can just say, hey, Matthew, come help me.
I'm smiling because we've had this conversation both internally and with agent broker partners over the past couple of years, and you're not the first person to ask for this. So let's go back and we'll chat with our product VP and resurface that conversation.
I just have one last comment. I don't know who maybe I should talk to about it, address to about it. Somebody was talking about social media, and I just realized something about social media campaigns. If you're gonna launch a new brand, you might know that with social media, when you're posting a video, you never know if it's gonna go there or not. So one thing as a social media creator, I can share that what I faced is that it's very hard to go through the social media noise, like through all the content that's there. So maybe it's worth thinking about when you pay a social media creator to do a social campaign, to do like a video too. Sometimes you can click a button there where you let Instagram and because I think Marketplace is going as a campaign partner. So there's like a button you can click to say, advertise this video, and if Insurance Marketplace says yes, then maybe it's worth paying additional money to Instagram to actually to go through this social media noise and just you need like $50 maybe for that. So you don't need that much, especially for Oregon. Maybe it's just worth thinking about that. I just have additional finances.
And Amy is the person to talk to.
Okay, cool. Yeah, that's what I realized.
Hey, I was just going to chime in here. I want to thank everyone for the conversation. I know we're actually a little bit over time. I think we need to move to public comment, but just wanted to check with folks in the room and make sure. I know we're just going to lose, we're at the top of the hour. So Chicky and others, okay to move to public comment? I know there's a lot of conversation and we'll be revisiting this topic as well.
Dawn, did we get any requests? Okay, and our only members in the public have opted to leave early. Oh, Rick Blackwell from Pacific Source.
Okay, very good. Thank you, committee members. I'll be real brief. I'm Rick Blackwell. I'm the Director of Government Relations for Pacific Source here in Oregon. Heard a lot of great ideas today. I'm just speaking in particular to the strategic plan discussions. I think there's a lot that really falls in line with what the legislature was hearing when Senate Bill 972 was being adopted back in 2023. I do think I'd like to urge the committee to think of just two things. So one is urge some patience for the rollout of the platform. I think there's a lot of public trust that needs to be restored in getting meeting job one, which is to make sure the exchange is up, running, and working. And I think two, just urge maybe some broader conversation about these strategic priorities. There's a few things that I heard, I think in particular, I clued in on the AV calculator as a former insurance regulator nerd myself, that probably needs some discussion with ECBS as they're the entity that sets the standard plan design in Oregon. So I think I'd urge the committee to maybe bring some more voices in when completing this strategic plan. So I'll leave it at that. It's been a long meeting. Appreciate the opportunity. Thank you.
Thanks, Rick. Anyone else from a public comment perspective? Just looking at and you said no one in the room, right?
There is nobody else in the room.
Okay. Well, I know you're in the room, but
Sorry, no other members of the public.
We need more caffeine. Thanks everyone for hanging in there. I am jealous of those who could gather in person. I'm glad we all had this time though. Our next meeting, I was just checking to make sure I also see it on the calendar, is scheduled for Thursday, July 16th at 9:05. And I think this one is, it's scheduled as Teams right now. It won't be in person. I don't know if y'all switch it to Zoom, but that's our platform. Chicky or others, any kind of remaining business for this last little bit?
Yes. So actually, our next meeting, it's not a regular meeting, but it's June 25th that we will be talking about the 2027 Marketplace Assessment Rate. That's kind of a more
there it is.
Ad hoc.
Right.
July 16th is our next regular meeting. I will be needing to touch base with our chairs and co-chairs because the vibe in an in-person meeting just has been awesome, fantastic. So We may offer another hybrid option. It really depends. We're seeing, okay, Chair Lindsay Hopper and Vice Chair Neshoba Temperley, I think we have some offline conversations to have in terms of maybe a July hybrid option as well. Hopefully the weather is much better and there should be no more snow in the past. That would be really bad if there is. Hopefully not. I think that's definitely up for conversation, and we'll definitely touch base with the committee for options. But June for sure will be virtual. July might have a hybrid option.
So folks should just keep an eye out for an updated email on July, but June feels pretty bankable. Is that a good summary?
Yeah. Yes.
All right. Well, I think with that, we'll call it and wish everyone a good rest of their day and a good rest of their April.
So good to see you.
Very much, guys.